Welcome back to Clearly Aligned Podcast. I'm Kelly Tyrrell, and I'm here with founder Dr. Stephen Schulk and our guest number two, back for part two of Business Conversations with Chris Cito. So welcome back, guys. We have a lot to talk about. We have a lot to finish up on this Business Conversations chat.
Oh, yeah.
Yeah. We went a long way on the need and understanding patients, or getting patients to understand the need. Still a few more items to touch on.
So if you haven't heard part one, go check that out first. You can get an understanding of Chris's background and how he's come to join us on the team here at Clearly Aligned. Just giving a quick background and summary towards Chris and his journey. So started off as a teacher, then started working for Invisalign as a rep. We never really finished talking on this point in the last one. So after that, he went to work for a company called Smile Sonica, which produces the AVO device, which is an acceleration device. And he was their global head of sales. And then from there, he's come to join us after 2 years of me pestering him. He's finally come to join us at Clearly Aligned. And Chris has so many insights. I said in the last podcast, but I'll say it again here. I don't think I would be in the spot that I'm in today if it wasn't for Chris and the value that he's brought to me and my team as an Invisalign rep, to the point that, again, he was invited to my wedding. We pretty much talked every single day for years and years and years. So the insights that he provides in today's session are just so welcome and valuable. And a lot of the things that kind of changed my thinking. I was a very classic dentist of like, no, I've got like my plan. I know what I'm doing. And Chris came in and he dropped wisdom bombs on me. And it changed the way that we approach many, many things here. So if you've heard me speak previously on business systems and strategies, you're probably hearing Chris speaking through me in some ways. So very, very glad that we can bring you on to share that wisdom with our listeners.
Well, so yeah, thank you very much. I don't know if I can take credit for a lot of that stuff. I think it was a joint partnership, and the two of us bouncing a lot of ideas off each other, and then you actually taking them and executing them, which is probably the biggest and most key part. You can have all the ideas in the world, but if you don't execute, they don't really mean anything. But I appreciate the kind words, Stephen. Very nice. Thank you.
So we did the needs, and we kind of talked about the value. I think the needs kind of like led into the value. So both our team members know the value of what we're offering, the foundation, setting the foundation, which is ortho, so that we can build beautiful restorative and lifelong smiles above that.
Yeah. Can you take us a step back and just take us through? You had such an insightful 5 different aspects and areas that matter. Can you tell us what those are?
Yeah, so it's really 5 reasons that consumers don't buy, right? So we were talking about, Kelly was saying how a lot of the doctors that communicate with us or come to the courses are asking about strategies on how to increase patient acceptance for their orthodontic treatment, looking for verbiage. And I just said that there are really 5 reasons why people don't buy, right? And that includes your patients. And that's, really there's no need. There's no trust, there's no value, there's no time, or there's no money. So those are the 5 reasons. And if we all think about that from our own perspective, when we go to purchase anything as consumers, it's usually one of those reasons why we're not going to move forward with a purchase. And it's the same thing, I think, for patients. If you think, it's interesting because often you don't want to think of your patients as consumers. They're your patients, right? You're treating them, you're taking care of their oral health, but ultimately we're all consumers. So I think if we put this in our mindset and address those 5 components to why patients won't move forward with treatment, you'll see a significant increase in your conversion rate or your patient acceptance rate for Invisalign or any other dental treatment that you're offering in the practice. I think it's very transferable. It's not just orthodontics that this will transfer over to. It's really all dental treatments that you're providing that require some form of payment and commitment from your patients. So we did cover the need portion in part 1. I think we did talk a little bit about the value, trust, but I think we can kind of come back to the value component. and kind of start there. I know, like, looking at the need, we want to make sure patients understand that there's a problem before we provide a solution, right? And if the solution is orthodontic treatment and you're using Invisalign as a tool to come to that goal, patients need to understand why they need that treatment, right? If there's no need, then it doesn't matter what solution you present to a patient, they're not moving forward, right? It's kind of like selling somebody a banana peeler, right? You got the best, most high-tech banana peeler in the world, right? I don't have a need for a banana peeler. I'm never going to buy that, no matter how great it is. So it's the same thing when it comes to patients. And I think we talked about that. But I think in the value component, we did touch on that a little bit. And the value does come from patients understanding why they need treatment. But, Dr. Shaw, maybe you can talk a little bit about, how you guys convey value in your practice when you're talking to your patients, or Kelly, in your time in the orthodontic practices, how you've conveyed value to the patients.
First of all, just got to say, it sounds so weird hearing you call me Dr. Schalk.
I know, I thought the same
We
thing.
need to stop that right away.
Yeah, I go back and forth. I don't know.
Fair enough.
I don't know if I'll always call you Dr. Shaw.
I don't know if the doctors who are listening right now, if you guys are similar, but what I tell my staff is I say, whenever we're in the office or we're away from patients, I'm Steven. If I'm ever in front of a patient, I'm always Dr. Schalk.
Especially because we're the old people, Chris. Me and you are the old guys. He's like even too young to be one of your grade 8 students.
Yeah, very true. Yeah.
Yeah.
Like JK, or like in the womb.
Yeah. What year did you start teaching?
1995.
Okay, you want to know how old? Oh, no, we'll leave it.
Well, that's 28 years ago, and
Yeah.
you're what, 33? So you're 5.
Yeah, I was 5.
Oh,
Born
he was in the
90.
JK fence crying.
I was with my kindergarten teacher, Mrs. Dukeshire.
Yeah.
He was probably building really great Lego foundations, and everyone was like, "Wow, this child genius. He's gonna go places." That
he really
Steven.
lays the foundation properly. Okay,
Yes.
so jumping into Chris's question here, showing the value. And first of all, I love this. Like these 5 are so phenomenal, because as you think about any purchase, like just buying a new iPhone, for example, I just bought one, or I'm setting up my home recording studio here. And it's like, yeah, the need, the value, the money, all the different aspects. If you don't have those, you can't do it. It's a barrier. So, but coming to the value, I think the value that patients want to see is that, I mean, I say this all the time when I lecture, patients don't want cheap. Patients want value. Patients don't want fast. Patients want efficient. Mm-hmm. Right? We think that we need to finish the treatment in 6 months or they're not going to move ahead with us. But that's completely contrary to my patients that have been in treatment for 2 years, because they're really complicated cases and they want to see the results. And so we need to show that value when we're doing our presentations to the patients. And so if you as the doctor don't show what your value in this equation is and the value of your team, all you're doing then is dispensing a product. Another analogy would be, right now we are looking to put a swimming pool into the new build of a house that we're building right now. And so what I don't really know right now is every company who's looking to put in swimming pools, is a swimming pool, a swimming pool, a swimming pool? Does it matter who's installing it because it's just from out of a box and you just put it in? Is it just assembly required, or is there a lot more involved with it? And so the same thing, some patients think that like, oh, well, all I'm doing is I buy this product of Invisalign and everything just magically happens for me in the background. I get the trays, just like Smile Direct Club, and I pop them in and everything just works. Well, the recent news being that Smile Direct Club just filed bankruptcy really shows us that clear aligners are not clear aligners are not clear aligners. And the provider behind those clear aligners is not the same. And so the value that you need to show your patients is how you matter in this equation. Because if everything is equal across all playing fields, then they should go to the cheapest provider in their area. Mm-hmm. Well, at our practice, we don't charge the cheapest. We actually charge about $7,800 or even over $8,000. The orthos charge about $7,800 or $7,600. The GPs probably charge just over $5,000. The reason why the patients pay that is because they see that value. When they come in for the consult, we're showing them on their outcome simulator what their teeth would look like if they're put into the proper position. The outcome simulator is just the spot on Invisalign's iTero where you can click a button and it shows the before and the projected after. But again, show that value. When you click that projected outcome, a lot of times it's really, really bad. It doesn't show the teeth in the right spot and it looks a little bit ugly. And so you as the provider can go in and you can change and move around the tooth positions a little bit to show where a more ideal position would be. And you do that in live time right in front of the patients. And so when patients see the provider doing that, they understand that my intellectual abilities are needed in order to set this case up. That I'm a huge part of being the mastermind behind this case. So really, if you broke it down and distilled it to its core elements, what you would see is the value I'm providing for my patients is confidence that there's a leader, there's someone in place who's going to say, I will take your case and I will take you from point A to Z or Z for our Americans. I will take you through that entire process. I will make sure that everything runs properly and efficiently and get you the results that you're expecting at the end of the day. And I'll continue going as long as needed. I'm not going to charge you more if we need more batches of aligners, but it's also not going to be cheaper if we finish more efficiently because we do a better job with planning it and you do a really good job wearing them. But I think that's really what they need, and what the value that we're selling them is the result at the end of the day with excellent quality behind it. And patients will be willing to pay that. And I think this is such a testament that, Chris, we were both on a call last week with a doctor from Toronto, and they're in one of the most competitive markets in Canada. And I previously on a webcast was told by a doctor, well, sure, you charge about $8,000, Stephen. That's all fine for you. You practice in a smaller center. You can't do that in Toronto. Well, this doctor, downtown Toronto, charges over $8,000 per case. And the reason why is because they provide and show the value to the patient. And if the patient's their main determination of whether they're going to move ahead is strictly just financial, and they don't care for all the extra value of making sure that the case is done properly and the best results given to the patient, then they'll go somewhere else. But he's doing like 100 cases a year, charging $8,000 in downtown Toronto. So I really just reject that notion that you one can't charge for the value that you provide. And number two, I think it just really, really shows the value that we can give patients. But to me, it really comes down to showing that value initially for those new patients in the consult. And then, of course, we need to show it throughout treatment in order to make sure that word of mouth continues to bring in more consults. But the value really is given in the consult by giving them your time and doing a comprehensive, thorough consult.
I think that's why you're so well respected in the industry, not just amongst your GP peers, but also amongst the orthodontists. I mean, you're very well regarded. I mean, I wouldn't be here. I wouldn't be here if I didn't think so. But yeah, everyone that I know of sings your praises. But one, because you've done so much education, you've done your due diligence, you're doing high quality work, delivering excellence. The patients are always presented the best case scenario. And then if they want to work back and do something compromised, that's their choice. But we treat like orthodontists, and we also bill like orthodontists. And so we're not competing on any of those little levels. We're not playing that game, but you're differentiating yourself and showing the patients the value. So sometimes it's the value of time, or it's the value of, excellence, or whatever they want. Everyone has different places, values on different things. And I mean, you cater to them all, apart from price. Apart from price, we don't dilly dally there. I mean, a freebie is a freebie. If you have a special situation, we're all about charity. But that's the only price game we play.
Totally. Well, that's the thing is one of my really good friends, Peter Braun, always said to me, Stephen, what's your unfair advantage? What are you going to do better than everybody else? And he said that you need to have one unfair advantage. And my thought was, well, why can't we have 10? I want to have 10 unfair advantages. So I want to give the most comprehensive results possible in the most efficient timeline possible with the most aesthetic treatment by doing attachments on the lingual of the anterior teeth. And I want the experience to be as comfortable as possible with the fewest number of appointments as possible using dental monitoring. And so if you can really hit on like 5 or 6 of these unfair advantages, that you're like, well, now I'm the most comprehensive with the bumps on the inside, the most aesthetic, with the fastest, with the most, for what we're providing. With the fewest number of appointments, it's kind of like the only thing that I'm not compromising on is our profitability. And
And
then
when
for
you think
me,
about it, how much are they saving by not coming in, by not wasting their time, and time being even an extra years of treatment of unnecessary refinements. We're all for refinements because we do hard things, but unplanned refinements because mistakes were made.
Yes.
So they're totally getting their money's worth. That's
Yeah.
gas and parking and time out of school and work.
And
Yeah.
we'll talk on this in a moment when we get to more of the money side of things, but then also that like fifth, sixth, seventh unfair advantage. I also want to be the most competitive with giving my patients financing terms that are going to allow them to move ahead with treatment. I'm not going to be like, hey, you need to pay me in full. I'm going to give them really, really good financing terms so that the money is not going to be a barrier, even though we're going to be charging a lot for it. But we'll come to that one when we get to that section. Chris, can you give insights into, you have so much wealth of experience. Tell us what you think.
I think everything that you said is 100% what you need to provide your patient, and I think it translates a lot to the confidence of the doctor, right? When you're confident in what you're doing, you're confident in the fact that you have the education to support you, you're confident in the treatments that you've provided in the past, you're able to show examples to patients, and that translates very strongly to your patient, right? If you're not confident in consult and you're like, I don't know if I can treat this, but if you come in, you're confident, that value there that the patient sees in terms of, okay, I know this doctor can help me because of the confidence they're displaying while they talk about this. That's huge. I think the part also that you got to consider is, do we know what's valuable to the patient? Right? Have we had a conversation? And that's probably one of the biggest missing pieces that I've seen in all the practices that I've been in, whether it's a ortho practice with treatment coordinators or it's team members in a dental practice, is the ability to do the discovery, right? And understand what's important to the patient, right? It's really important to have those unfair advantages or your superior value propositions that you have compared to other, practices in your area, but those may not even matter to the patient, right? You have to have them, right? They matter. But if you can understand what's important to the patient, and how do we do that? Well, we talk to the patient, right? Kelly, you're great at this. You connect really well with your patients. You know about their lives. It doesn't hurt even to ask, what's important to you as you go through this treatment, but doing it in a way in the discovery and in sales, it's called probing, right? Which
we don't like probing at the dental office.
There's only one probing. That's
or questioning, right? Like it's interesting because as we have this podcast, right? I'm going to throw some things out there from the sales side of things with doctors or team members. You sit there and sit and talk to your reps, and all of a sudden you're like, oh, I know what you're doing. Right? Like you're having these questions, you're trying to really understand the needs of your patient, one, but what's valuable, right? So that when you acquire that information, or if you can acquire it some other way in a pre-questionnaire, lifestyle questionnaire that you send prior to consult, then you have that information, what's valuable to the patient, and then you can tie that into what your office provides, right? Like if it's time is so valuable to me, right? I have no time. I have 4 kids. I can't get away from work. I don't want my kids missing school. I value time, and this is not going to work if I have to come here every 4 weeks to have an appointment, right? How do we accommodate for that? How do we translate that into the consult, into the patient? If it's whatever it may be, they value education. They value deep understanding. They're super type A engineer, and they want to know the biomechanics, right? Most patients don't want to know that. But that 1-2% might.
Those ones that do.
So you need to identify that is valuable to that patient and go down that path. For the most, I would say keep it very simple, keep it in lay terms. But if you see a patient like that, you got to get more scientific.
Flag that in the chart so that each visit you give them just that little bit of extra that is irrelevant to most people. And like dental assistants, hygienists, admin, the front desk team is amazing. We know so much about these patients that our doctors might not even know. So if time is a problem, or child is in rehab, for God's sakes, like they're stressed out, whatever their need or their value is, tee your doctor up. So when they get into that consult appointment, they're just like, they can hammer that down. All the other things are nice, icing on the cake, but you can really be like, this is going to totally fit into your lifestyle. It's going to be easy. Like, we're going to be free sailing and all the obstacles are gone. Just sign me up.
Just man, I'm getting like brain waves right now about a few different things that are so interesting. Hopefully I don't want to forget them. So because I want to hit on all of these in their proper course, but I think that's so correct, because the other thing is, so we used to, and I don't know why we got away from this, but we would have it in our new patient paperwork for the aligner therapy side that we would have them rank how much it mattered to them to be done quickly, how much it mattered to them to have like the most comprehensive, ideal case finish, the results. We would have them rank all of those. And then you could kind of come in and be like, okay, well, you really care about comprehensive treatment. So do I. And you do want to be done quickly. Okay, let's talk about acceleration devices with an AVO, or in the past, an OrthoPulse. Right? Or you very much value comprehensive treatment over aesthetics because you've put a 1 for aesthetics. So they don't care if the bumps are on the outside. They just want whatever's going to be the best and whatever's going to be the fastest. Okay, we can tailor that to that approach. One thing, so this was my brainwave, was we have patients sometimes who have different values than us, and we might force them into a box that we shouldn't force them into. And what I mean by that is there's one patient in my mind right now I'm thinking about, and he shows up late every single time. And it's so frustrating because he shows up late and it puts the assistants like 20 minutes late on an appointment that's only half an hour long. Well, now they've just lost their lunch. And so our staff is very, very frustrated with him. And they've kind of said, okay, we need to get things to the point that we tell him if he's late even by a minute, as a matter of principle, we're not seeing him because he's been late 5 times and we've talked to him. But this patient values the ability to come into a practice. He's a millennial or Gen X, Z. What's the, I should know this.
He's the younger one.
He's the younger one. He's a Z, right?
Yeah.
Okay. So he's a Gen Z. And so he values the ability to walk in late to an appointment. Now, that's not something we value, but is that something that, like, is that what he values? Yes, he does. And I have a patient like that from about 2 to 3 years ago. I did amazing results. I actually presented on his case at Summit. One of the craziest cases you've ever seen. He is so happy. But because as we got close to the end of treatment, he kept abusing our time with being really late, it meant that I sat down and we actually charged him a fee. He ended up leaving the practice very unhappy because we charged him a fee of $100 because he kept no-showing us. And in the end then, I could have done something differently. What I realize is that I should have actually accommodated, if I could accommodate for that. And I'm not saying that you should all do this, that this is what you do. I think we were justified in telling him that he had to be on time, and then when he wasn't, that we had to charge him this fee. But what we could have done is we could have gone ahead and said to him, how much do you value the ability, because you're really, really busy in your job, to have more flexibility on when you come in for your appointment? And if he said, well, yeah, I really struggle to come in on time, or if we just recognize that, we could have changed the equation to say, okay, well, what we're going to do is we're going to book you into this spot and we're going to put him in half an hour earlier than where we were. But here's the trade-off for him. If you're coming in and you really value that component, you may have to wait once you arrive here, because we can give you a window that you can come in at any time you want, but we won't necessarily be able to treat you immediately in that window. Now, I wouldn't do that for every single patient. That would create a disaster. But for these 2 particular patients, that's a way that instead of kind of forcing them into our box, we could go ahead and give them something that they value. And you might be listening right now and completely disagree and say, well, like, no, we need to control our patients, Stephen. And this is just a brainwave that's coming to me right now. But I think there's a way that we could do things for those patients where either they're booked first patient of the day, or we book them over a window of time, but we do something to see what they value. And maybe they value the ability to come in at more flexible times or at different times. And that means that for us, the way that we balance that, if we know that from the very beginning, is we charge them more. We charge them what would be the cost of 2 no-show fees from the very start of treatment, because we know from their hygiene side that they're not always the most reliable or dependable patients for that.
Mhm.
So it just kind of
That's a
gave me
good
that brain.
differentiator. There's another one. You can add that to your like
Yeah.
11th differentiator. It's like walking clinic ortho.
Yeah.
We'll get you on the fly.
But it leads to what Chris is saying here. If we don't take the time to find out what they value, then
Right.
we might think that, oh, well, this patient really values being done fast or being comprehensive in treatment, but they don't. They value more the efficiency of coming in when they want to come in or something like that. We were just telling Chris at the end of our last podcast that Kelly and I once recorded a full 2-hour podcast and then realized that none of the sound was recording the entire time. So we do a lot of checks and balances normally now to make sure that doesn't happen. But I like Kelly's thoroughness here. And Kelly, tell us how your daughter wanted to have a friend over this morning and what you said.
Well, it's like a PA day because it's a long weekend and I've got like a lot of people in my house coming and going. And so my daughter, my 13-year-old, wanted to have a sleepover. I'm like, at our house, it's always at our house. And so I said, yeah, you can do that, but you have to sleep outside in the tent because I didn't want her coming in and out. And like they wake up at all hours of the day for breakfast. So it's going to be in the middle of a podcast and then the dog will bark. And anyway, so everyone's on lockdown. I don't know where they all are, but grandma, husband, teenagers are all on lockdown.
I love
Even
it.
the dog's quiet. I think Rob carried that crippled dog upstairs and put him on the outside porch.
So, Chris, this is the dedication we expect from you.
Yeah. Yeah.
All right. So, jumping back into our topics here, I think we've gone through value well enough.
Yes.
Yeah, so I think we can transfer, pivot over to trust, because I think we did cover a portion of that. I think providing excellent value and your patients understanding the value of what you're offering them leads into trust. But I guess for you guys, what would you think that in terms of creating trust with your patients, how are you creating that component?
You know what? I think when you're starting something new and you're thinking about ortho, like whatever, I'm dropping in implants and that's new to me, or I'm starting to do ortho. You're thinking, do they trust my ortho? Do they trust my skills? Well, you know what? They kind of think you're a doctor, like orthos are orthos, doctors are doctors. So I think you can just let that go. Just embrace the fact they probably trust your skill because you have a certificate on the wall. I think for a lot of patients who have walked through the door, they've already looked you up on social media, on your website. They want to like you before they walk through the door. So they want you to kind of deliver on, are you that guy I'm seeing on the website or on social media? Are you that likable guy? Are you that guy who says he's doing stuff in the community and for charity and you are efficient and all of these things that you're outlining that you're doing for us, all these values that you're offering? Are you that guy? Like, show it to me. And you don't have to prove them all, but I think people are coming in wanting to trust you to begin with. So unless you're talking yourself out of it, most patients, I think, are already there, especially in a GP office. A lot of these patients are your patients of record, like they're coming in for regular visits. So they already know and like you. And so naturally, they're going to trust you. You just have to, tell them what you're up to and not tell them too much information that you talk yourself out of the business. That's what I find a lot of doctors do.
Yeah, no, I think that those are good insights, Kelly. In terms of the trust side, I think what you just said, you break it down into two components, really. There's two buckets. There's the patients that you already know and already trust you, and you have that from a relationship spanning potentially a decade or however many years you've been seeing them and their family. Sometimes I'm going through all these different things in a explanation for an ortho consult, and I'll talk to some doctors who have been running their practices for 5 years, and they're like, Stephen, you can just stop. Like, all I need to do is tell them that they require orthodontic treatment and that Invisalign's the product that we'd be looking to use to straighten their teeth. Sorry, let me rephrase that. That my child's teeth are in an incorrect position and they'd benefit from having them in the proper position, and that by moving them, we'll do that with aligners. That's all they really need to know. And they don't need me to go ahead and sell them on a lot of other aspects here and on myself, because they know me and they trust me. And that's something that almost no ortho has. You only get that on the second and the third child. And so for that reason, I think you need to know who you're talking to. And so if it's someone that, like for me with some of these consults, when I've got a second, third, or fourth child, like I walk in there and it's just like, hey, Diane, how's it going? It's so great to see you. Like, how's the family? How's your summer? How's everything going on? Like, we'll spend 10 minutes just talking about nothing to do with this kid. And then I'll be like, oh, I see you have Timmy in today. Okay, yep. So Timmy, how are you feeling about like you're doing your treatment. You're the most important person in the room right now. I want to know how you feel. Let them talk. Okay. I kind of know the parents already. So it's how do you feel about moving ahead with this? And they're like, yeah, let's do it. So I'm not going through that whole same approach for every single patient the same exact way. But when I have someone who comes in, and this is a huge scale of what you have with patients coming in, it could range from someone who's come in who's researched you, like you said, Kelly, who they kind of know already. They're like, hey, I know you're one of the top people in our community for doing this. And they're more on board. Or you could get someone who, like I had this one about a month ago, where it was a divorced couple with the partner of the wife is remarried or has a new partner, and then they've got their kid in the chair, and it was just like ice cold. Like it was awkward and uncomfortable, and the biologic or the dad, I shouldn't say biologic dad, but the dad, he didn't want to pay for treatment. And so he was trying to find every opportunity to say like, this is invaluable. Or he was trying to almost like get me to say something like come out and say like, they need
It's
this
not
or they don't
necessary,
need
yeah.
this, or it's necessary or not. And I said to him like, look,
No one can
did
buy
anybody
it.
ever die from not having orthodontic treatment?
Yeah.
Probably not. No. But is there value to putting the teeth in the proper position? Yes. So it just depends on what your value is. And so in that situation, the trust that I got, they moved ahead with their treatment in the end. And it was probably a good 20-minute ice cold, strange conversation. But the trust that I was giving was actually not committing to saying they need treatment or they don't need treatment. It was actually just being genuine and being like, you could do it and it would probably benefit them tremendously. You could also not do it and they're not going to die. And so I think that trustworthy aspect sometimes of also presenting, like there's someone I was just listening to recently was saying every single patient, no matter what, is an Invisalign patient, is it like no matter what, if they want it, you sell them on it. Well, no, the trustworthy part comes from giving them your honest, genuine thoughts and also giving them the option of no treatment. Because anybody who comes across and makes it seem like they're going to die because they don't get this malocclusion fixed is disingenuous. And the thing that I think is so interesting and cool is that I had a patient who came in and they moved ahead with treatment, and we asked them, how did you hear about us? And they said, oh, well, I moved ahead because one of my colleagues went and they had a consult with you. And I'm like, oh, who was it? What's their name? And they give me the name and I look it up and I don't remember them. I'm like, who is this person? Which is not uncommon nowadays. But they're like, oh, no, they didn't do treatment with you. And it was like, oh. And like, oh no, you actually told them that like they have this malocclusion and you kind of presented it to them and you told them that it's something they could move ahead with or they might not need to move, like they could choose not to right now. And they had to decide between that and that, like they were having a lot of financial struggles and issues. They're actually, I think, coming in to see you again in 2 weeks. But you actually were like very genuine with them and kind of gave them very practical advice that if they decided to hold off for a year, 2 years, 3 years, like, yes, the problem would get worse, but it wasn't something that like I'm reading between the lines. They didn't say all of this.
Right.
But they're like, you were so genuine and authentic with them that they went somewhere else and they were told like, oh, your teeth are all going to fall out if you don't go ahead and do orthodontic treatment. And you gave them
that's exactly right. Like the just nice, the neighborly conversations we would have with our friend, like a divorcing couple. Yes, Timmy would do better right if we did it right now. What are the consequences if we delay 2 years? He'll be in grade 9 with these braces. So pick and choose. Can you feed him? Can you clothe him? Is he still going to get ortho at the end of the day? Yeah, maybe just at a different time. Like people appreciate that, right?
Yeah. And I said that to them even. To be honest with you right now, if your financial situation, again, I didn't want to like pry and make it uncomfortable, but if just looking at it either on the like logistics or financials or whatever it is, if they want to go ahead and do the treatment, like they weren't a big class 2 skeletal discrepancy where we had to use growth modification. It was just crowded teeth. So when they're 18, 19, 20, they could go ahead and they can pay for it themselves. I have lots of patients who end up doing that. If it's something that they value, they'll be able to do it. I think the kid was like 14. They can go ahead and do it at that point. It won't significantly change other than the fact that there'll be some continued grinding and wear and harder to keep the teeth clean. But I think that authenticity really, really comes through. Whereas if you force it and it's like because sometimes, again, we hear that, like, you're going to die if you don't get your teeth fixed here. You got to really believe it and sell it. And that's also what most of you listening right now are going to say, like, I don't want to be that person. I don't want to force it. And I'm not going to lie. It sucks when you do an hour consult, if that's the amount of time you choose to do. That's what we actually do. And then you tell them like, you know what, you're okay. Like you don't really need to do any ortho, because they're finding us, they're not coming in from a hygiene where we would tell them like, you're whatever. I don't want to say okay or whatnot, but if they're coming in as an external patient, but the reality is you spend that hour and being genuine and authentic, the number of patients that we've also had shuffle over to our hygiene side and said,
Right.
like, you guys are trustworthy. I want to stay here. I really value what you said and the time that you gave me for no charge, complimentary. And so I'm going to go ahead and do all the rest of my treatment here. We had one maybe last year where they ended up going ahead and they wouldn't have benefited from ortho because their teeth were so ideal, but they ended up, I connected them to our restorative doctor who ended up doing 10 veneers on them. So it was still $15,000 worth of treatment. Because,
or they refer all their neighbors and friends,
Yeah.
even if they don't end up with you at all, just because they had a good experience. And like, oh, that guy's so likable, and oh my God, they have like the latest and greatest equipment in there. It was crazy. You know, people will be drawn to you if you're doing the right thing.
Totally.
Yeah.
Chris, what insights do you have?
Yeah, well, you hit on a lot of the things that I had in my head. I think the first one is just authenticity, like you mentioned, right? Being authentic with your patients or the potential patients that are coming into your practice, and not being pushy, obviously, not being salesy, as we talked about in the last podcast. But dentists that are doing orthodontics are in a beautiful position. Right. Like you said, orthodontists don't have this opportunity to already know their patients, already have developed relationships and have trust established over potentially many, many years. So a lot of the patients actually will move forward with treatment as long as they understand why they need the treatment, and going back to the need, because they already trust you. They believe, and I think you've probably had it, and Kelly, maybe you've seen it in offices as well, and not necessarily in the ortho side, but in the dental practice, where it's a crazy case and you want to refer it. And the patient is like, I'm not doing this unless you do it for me, because I know you, I trust you. I don't want to go anywhere else. And I think I've heard this story many, many times. And doctors take on cases they shouldn't just because that's their patient. But you've
they
had
understand that journey. They're understanding, committing to you, that I get, you're telling me, you're being authentic with me and honest with me, that you don't really know how to do this. Like you don't know all of it, but like, let's take the journey together. Let's jump together. And I mean, I would say for our tribe who follows us, or whatever, our doctor members, a lot of them are beginners or intermediate providers who are doing more things. I mean, be honest about it. Just say, hey, you know what? I've never done a case like yours, but I'd love to try it. And I have this amazing mentorship group. I belong to this amazing mentorship group, and we all share cases and share ideas. So you're like in a best position. It's like having a team of doctors treat you. Patients appreciate that. No big deal. Be honest.
Absolutely. And it's so true what you're saying there. Like the number of times that I've had doctors who said, I need to treat this patient because they only want me. Like what a value that just shows of how much trust matters. That they would rather have somebody who's like even telling them like, I don't really want to or can't, or think that this would be better seen by somebody else, but they trust you so much more that they're willing to be in the journey with you as you learn. So other things that I think bring a lot of value in terms of the trust component, because let's say you don't have someone who comes in who doesn't really need treatment, or who you like they want to move ahead with you, and it's not the circumstance where we're kind of saying, well, you don't have to get treatment done here. But how else do you build trust? Well, I think it's explaining to them. So number one, I would say, is patients want trust on the financial side. They don't, like, everybody is scared that they're going to be taken advantage of. Like as we're looking to build a pool, that's a worry for me. Are they going to know that I'm a dentist and they're going to charge me more? Are they going to start the project and not give me the full scope of their work and charge me more? It's a genuine concern. When you go to the car dealership, why do you not like going there? Well, if I don't say the right phrase, if I show that I'm too interested, if I do something wrong, they're going to treat me differently because they know some information that they can get more money out of me. That's the worry. Yeah. So on the financial side, I think explaining to the patients here that the cost of treatment, like this is all included. You don't need to pay. Like that's why I recommend don't charge for retainers at the end, because even if you explain that, it's still just like that you've given those numbers, and then at the end you're getting more costs, and we did this when we used to charge for retainers, and patients then lost that trust at the end. I think by giving them one all-included price and explaining to them that as long as you're doing your component, like you're wearing your trays properly and you're doing everything the way you should be, and we put parameters in place, but this is all included. If you are not tracking and you're not compliant with your treatment, then we do have the option to charge them additional fees. We have that in the contract. But assuming that you're wearing your trays properly here, this is all included. I'm taking you from the very, very beginning to the very, very end. So give them that trust on the financial component to be just very open with them about it.
Yeah.
In terms of the trust for the practical doing, if you haven't met this patient and they're not begging you to treat their anterior crossbite with posterior bilateral crossbites, and it's the worst case in the world. If it's just a normal case and you're trying to build that trust, the other thing you need to do is ideally show them examples of cases that have been treated. They need to trust that you can do this with aligners, or that aligners can do it. Right? Can Invisalign actually treat this, quote unquote? And that's a thing that I think we miss out on too, is people come in and they have these preconceived notions that they have a family member who was treated with Smile Direct Club, or they have a family member who was treated with Invisalign, but by somebody who didn't know how to take control themselves, and they had really subpar results. It's like, oh, my sister had Invisalign, but like Invisalign doesn't work for whatever, for really crowded cases, for really deep bite cases, for my open bite. I've heard that from every single type of occlusion you can imagine. I have been told Invisalign can't work. Well, you know what is better than me saying like, yes, it can, and arguing with them? I just showed them an example. Or they've been told by the ortho that Invisalign can't do what they need it to do. I'll just say, well, I can't really speak for anybody else, but Invisalign is a tool. And it just depends who's using the tool and how they plan it and whatnot. Here is a case similar to your case. They actually came in and they said the exact same thing to me, that like they've been told Invisalign can't treat their bite. Here's their before pictures. Here's their after pictures. There's two different places where you can kind of get that if you've never treated those patients. Now, first preface this with, you have to actually be able to do it. You can't just say to them like, oh, no, we can do it. We'll do it. And then you don't deliver. Well, that's terrible in my opinion. Like, you can't not do it. You've got to deliver. So that means that you need to take the time to get educated and learn how to do it. But you don't necessarily need to have done that case in order to say to them, like, when I first started, I had pretty good confidence because the people I was learning from were excellent in what they did. And that's the goal with Clearly Aligned, is that you come on board, you learn, we'll teach you how to do it. We'll get that component figured out for you through the online or live course, or through a Facebook group, through all the different resources that we have available. But when you join Clearly Aligned, if you take the foundational systems course, we actually give an entire library of pretty much, I think there's like 30 to 40 different case types showing the before and after pictures that you can use with your patients to show them, well, here you can trust that this can be done with aligners as long as you're willing to put in the time and effort. And so I think that component as well is big for creating the trust that you are someone who actually knows that this can be done with aligner therapy. And then you show an example of a case, and ideally track your own library too. Once you start doing more and more of those cases, show them other examples like theirs. And that to me proves your trustworthiness very, very quickly.
And if you need help delivering it, obviously we have mentorship. We can help set up your ClinCheck and your treatment plans for those first 5 deep bite cases that you do. So then you do have your own library and you can be like, yeah, I did it. It is very confusing though, I will say, for customers, clients, patients coming in who've done multiple consults, because whether you went to 2 orthodontists and a GP or all orthodontists, everyone has a different recipe to get to the end based on the tools that they're comfortable with, or their preferences. Everyone has their favorite tools. And it's not that any plan is wrong. They will all ideally get you to a situation of excellence. So let's just, if we're all apples to apples, or let's just say there's 3 orthodontists, 3 paths, they're all going to probably have beautiful results, but they've all used very different tools, totally different plans. So it's so confusing for patients. Now they're coming into you and you're making it super simple, saying barely any appointments and lingual attachments. And yes, I can do it all in plastic. They're probably just like, what? Imagine
not trust you.
They're taking a huge leap of faith.
Yeah. Until you show them, they won't trust you if you just verbally say it, because And I think this is the interesting thing. The orthos, at least in our community, they don't really show a lot. They don't show on the outcome simulator, this is your current and this is where we'd like to get you to. From what patients tell me, they don't really show, like, here's a case like yours, what I call the tooth twin. And then here's where they were actually at the end of treatment. And so they can verbally show with their hands, like, here's all the different things. And yeah, we'll go ahead and get you all fixed up. But do the patients actually trust that they're going to get those results? In a lot of cases, yeah, the reputation of whoever's talking is good enough as the local orthodontist that, yeah, they do. They do. And they will. They'll give them good results. But how much more effective is it? How much more is that your unfair advantage if you actually show them what they're going to get with the tooth twin and the outcome simulation?
Yeah.
Visualization.
The one thing I always go back to when it comes to trust is the old, I think it's a sales saying, people buy from who they know, like, and trust. Right. So nobody's going to get to know you unless they like you, and nobody's going to trust you unless they know you. Right. So as dentists, I think the beauty is that you have a lot of these relationships established. I would say out of all the practices I've been to, the majority of their Invisalign patients are already patients in the practice, until you get to a certain volume where you're marketing and you're bringing in patients from outside of the practice that aren't regular patients, or you're getting referrals. And then that's really, at that point, is how are you going to develop that trust? Very similar to an orthodontist in their situations where, they don't know the patients. They come in for their first consult. If you're a dentist that has those types of patients, it's really, you have to sit back and think, okay, well, how do I develop trust in a short time span, so that they're comfortable with me? And a lot of things that you said, Stephen, in terms of showing them your competence, but also, I've been to dentists and I've seen them in action. And, I'll go back to Dr. Nathan Wong, who just did my root canal. He's very, very good in his bedside manner and how he connects with patients. And I've seen him with my kids before when they were new patients, and he talks to them, gets to know what they like, and really connects. And I think that's such an important part of developing trust with new patients, is that. And I think, I don't know how much of that do you guys learn in dental school, in terms of, do you learn any of that? Is there a course on how to talk to patients, right? So you guys kind of all learn from your mentors as you come out as new dentists. So I think that part is so valuable in terms of developing that trust quickly with patients, is just taking the time. And it might extend your consult a little bit, but taking the time, if it's a new patient, to really talk to them, get to know them a little bit, to get to know you, and then that will help with that trust value. But of course, like you said, with orthodontists, a lot of times that trust doesn't come until the second, third, or fourth kid, right? But if you can do everything in your power with a new patient that you don't already have an established relationship with to develop trust, you just put yourself in a better position for that patient to say yes to treatment, when they don't know you or your practice or your team.
Totally. And that's the thing, is the other aspect is, like, Christian Coachman talks about this, that there's two different ways to show that you're, like, expertise and that you are trustworthy. One is like a word of mouth referral from someone that they know and trust already. And so if that's coming from like a family friend or something like that, then you know that you're starting off in a better position than, like, oh, I Googled you and you're the top on Google. Then there's, of course, how it kind of plays in with, if you've met them before and they're your patient and you've spent 8 years treating them and their families, you've got that trust already. You're good. That's kind of the first one. The second one is showing your passion and your enthusiasm to them, and knowing your subject matter. Right? You could meet someone who, if someone's just jumping on, they've never heard us and Clearly Aligned before, they've never come to a course, nobody's referred them, there's no trust right now. If hopefully from hearing us speak, you recognize that we're passionate, enthusiastic, and that we know our subject matter. And so that's what is showing you that we have expertise in this area and that we're trustworthy. Mm-hmm. And so that's kind of the other component. So it's, first of all, diagnosing, well, how are they finding you? And then which direction do you need to go, and how much time do you need to spend to show that expertise? And your staff can help with that. When they're starting to gain the trust, before you come in for the consult, if they've gone ahead and started to explain some of those things, like, hey, you're a new patient, like, welcome to the practice here. You're in for an orthodontic consult. You're going to be seeing Dr. Schulk. They get to know the patient over the next half an hour. Hey, just so you know, Dr. Schalk is an international speaker. He's a Invisalign Diamond provider, which means he hits a significant case volume. He's excellent with his treatment and results. His goal is to make sure that you're going to be thoroughly happy with your results. And I know you're in really good hands.
Yeah.
Right?
You
That
know what?
is worth a lot.
Sorry.
Yeah, go ahead.
Yeah. Just as you were saying that, and I'll give a shout out to Dr. Terry Buchanich in her courses as well. She's very good with this type of thing. And one of the things she talks about is just the trust transfer, right? And it's not just, and you reminded me of this as you were talking about your team, talking about creating that value and the trust as well. And it's how do patients go through the practice in that consult situation? Who's handing them off to who? And how are you creating the trust and transferring that trust to the next person? And this is an example for, we're going to get into the financial presentation component. And that's if you've made it this far in the podcast, don't log off. Get to that point, because that's my favorite part. But one of the things that Terry says is, when she's bringing her patients to her financial coordinator or treatment coordinator, when you introduce them, create that trust by saying something like, this is so-and-so. She's our expert in insurance and our expert in financials, right? You've already created this perception in the patient's mind that, oh, these people know what they're talking about, and they automatically will trust them. And do you guys do that as well in the practice?
Yeah.
Stephen? Yeah.
Well, here's the ironic thing. I think I probably do that quite well. That like, oh, this is Brandy. She's our treatment coordinator. She's amazing. She knows everything about. I don't want to overhype her, but she's an expert in dealing with the finances and your insurance and all those different aspects. And she's going to create a path for you to be able to move ahead if it's something that you value. That's usually what I'll say. But what I ironically don't do as good of a job as I should is, and I think maybe because it's
self-promotion,
self-promotion, or talking to my assistants about, hey, I need you guys to hype me up. Mm-hmm. Like, I think sometimes I do walk in the room and I'm the other side where nobody is given, like, I don't really necessarily mix these two worlds of speaking. Like, sometimes people are shocked to find out that like my staff really don't know, I guess, how big Clearly Aligned is and like what things are like on the speaking side and how far and wide things have gone. And so we don't really like use that with patients. My staff aren't like, oh, here's Dr. Schalk. Like, did you know that he's an international speaker and yada, yada, yada. And
so, you have to do that.
I should.
I'm in the practice next week, right?
Yeah, you are. Yeah, you need to
get some little things on the flat screens paying around, like some little clips of you speaking and packed audiences, t-shirt that says the big guy.
Well, it's that whole thing of like, I don't want to come across as too like arrogant or tell them like, you have to hype me, because I fear that I don't want to, I don't know, I guess be arrogant or anything like that. So I don't. And that means that when I come in the room, like, I'm actually probably selling cases that are harder because my patients don't know. And my staff usually haven't necessarily gone through my history and my background. So it comes from my passion and my enthusiasm that's really closing the cases. When I have had staff who've gone in there and kind of like warmed the crowd up, so to speak, I did have some assistants.
Yeah, like all I have to say is, oh my God, he just got back from Vegas and he presented the 3 wildest cases like we'd ever seen. It was like mic drop. And that guy is like, the patient in the chair is probably thinking, well, I don't have circus teeth, so surely he can do mine if he can do that. That's what I would be thinking.
2 minutes. But so I just also, though, I think the takeaway I want anybody listening right now to have is that I haven't really used that, even though I should. I haven't. I don't. And sometimes I would say I love my staff. They're amazing. But I think that sometimes it would probably be even more challenging in our current situation in our office, because we don't do any of that at all. And so we're really working from behind, and I don't have trust with my patients because I don't do the general dentistry side anymore. So when they're coming to see me, I've never met them before, and I'm almost like cold, quote unquote, selling them. Again, I'm educating them. In 20 minutes.
And you look like you're 16.
And I look like I'm 16. So you better have good strategies for how you're going to close this case.
You know what? And I'm going to give another shout out to our friend Laura Kaffick Martin, who's been a speaker, globally for treatment coordinating and now working with another organization. But, she always talked about, your superpower? What's your dentist's superpower when it comes to orthodontics? And she was working with orthodontists, but the doctor she worked with, it was open bites, right? If they and she was the treatment coordinator, and it's really important that whoever the team member is that's connecting with these patients prior to them seeing the doctor can have some of these conversations, these discovery conversations, and what brings you in, what made you decide to come look at orthodontic treatment, if it's a true consult opposed to a chairside consult, which I'm not a big fan of. I like the actual consult. But to be able to hype up the doctor in that situation, my teeth are crowded and I want Invisalign. Oh, you came to the right place. Dr. Schalk has treated over 1,000 patients. He's a speaker for Invisalign. Like, you have to be able to have your team hype you up and not be scared to do that. And not in a way that sounds cheesy, but to demonstrate that you are, competent and skillful. And especially in your situation, right, you have a lot that they could be saying, right? For the average dentist,
so
whether it's your provider status or the number of cases that you've treated, or you've done tons,
even if
you've
you
been treating
haven't.
20.
Even if you haven't,
even
I
if you
think
haven't.
you could still very much be like, well, you've come to the right place, because Dr. Zito is so passionate, enthusiastic about these cases, and he loves treating clear aligner cases with Invisalign. Like, you're in great hands. Like, it doesn't even have to be any tangible thing. It's just, yeah.
And just even just promoting them as a human being, like, oh my gosh, I just love working for Dr. Fernandez. She's so warm-hearted. The days just fly by, and she just loves children. So, treating children and mixed dentition is her new passion. I mean, who doesn't want that person treating their child, even if it's their first case? And then as a provider, I mean, even if it is your first case, you just say, oh, I'm treating my husband and I'm treating my child. And they're automatically thinking, well, if you're treating your own family, like, you wouldn't treat your own family if you couldn't do it. And we're still learning. We all start somewhere. We're not going to fail.
Totally.
We're not going to.
And patients don't necessarily mind that much that we're still learning.
No.
Like, I think it's looked at actually as a positive if you say, like, oh, I was just taking courses, continuing to learn. I think don't maybe let them know that this is like the first time you're ever doing something. But if they know that, like, oh, I was working on, like, learning some new techniques on TADS or on, like, whatever is kind of the things I'm working on nowadays. Nobody's ever like, oh, wow, you went to a course this weekend that you're still learning. Like, I don't trust you. You need to have it all figured out.
Yeah.
Well, I think you can verbalize that in a way that, Dr. Schalk is always continuing to improve his skills and knowledge. And he just came back from a course. He takes multiple courses in orthodontics on a regular basis, so he stays up to date on the newest treatment philosophies. However you want to position it, right? It could be a very big positive that continuing education, which it is, right? Like, the more education that a doctor has, the better, in my opinion. But that can be disseminated to the patient or conveyed to the patient before they meet you, especially if it's a new patient, and that's going to help that trust. Just like when the doctor transfers the patient over to a team member, there's got to be some verbiage there that transfers that trust as well. So that's super important.
And I think
really,
too,
ahead, Kelly.
For the trust, I mean, we have so many great tools like the outcome simulator, the scanner. We have all their pictures up. We have their, gallery and their tooth twins and all these things. So that's fantastic. So let's assume that they trust us. You don't need to tell the patient your whole plan. Half the times, orthodontist, dentist, whatever, we haven't figured it out yet. We've met you for 5 minutes. We're saying, yes, we can do it. So yes, we can. And TC, we're nodding to you, take their money, because as long as they're willing, we're starting this case. And then how you're doing it, like all the step-by-step, the patients don't need to know that. And you don't need to explain it to them. All they need to know is if it's aligner therapy, there's a high probability you're going to have some bumps on your teeth, attachments. That's what they look like, clear, painless, blah, 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 blah. We might have to slenderize or smooth your teeth, possible. We don't know yet. We haven't worked up a plan, but you don't say that. You're just thinking it. I don't know, but let's throw it in there. No surprises. You want no surprises. And in some cases, we need to do elastics and blah, 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 blah. So you've thrown out what's in aligner therapy, elastics, possibly slenderizing, definitely attachments if you're in my practice. And so there's no surprises. And then if you want to add a little flair in there or show them something, fantastic, but you don't need to over explain anything. I think that's where a lot of people start going down rabbit holes and they don't really know what they're saying. And we could do this and we might do that. And then all of a sudden they trusted you. And now they're thinking, I don't trust you anymore.
Great point. You need to show that then by not getting in your own way and
Yes.
and showing like a lack of confidence, which is going to be a learning process. You're not going to have that right off the bat, but yeah.
And then I think the TCs, which Chris, this, I know you talk about this all the time. So, and I think we definitely need to get that in there. Is the TCs can also go down the same thing where they're starting to talk themselves out of the sale. They trust you, they want it. And all of a sudden you're talking so many numbers and so many different packages and options. I hate numbers. Just give me the number, spread it out, whatever. But Chris, you're always saying the financial presentation is upside down. And I think that's where a lot of the TCs or the doctors, a lot of doctors are still presenting their own finances. Oh my God, where are you finding your time? I don't know. I don't know. Delegation is the key here. But anyways, Chris, tell us all about turning the financial presentation right way up.
Well, I think that ties obviously into the no money component of the 5 reasons why patients won't buy. And it's obviously if somebody doesn't have a cent to their name, they're not going into orthodontic treatment. But I think when it comes to finances and money, it's less about cost and more about affordability. And how do we make things affordable? Because if you think about anything that you're going to buy that's a larger purchase, what do we say? We say, well, I'm not sure if I can afford that or not, right? We don't say, I'm not sure about the cost. Most times it's about affordability. And I think we live in a society of monthly payments. People understand that they can pay for things monthly. Everybody, the majority of consumers out there are fine with some form of interest too. I'm just going to throw that in there as a caveat for later conversation around third-party financing. But I've had, like I said, the opportunity to be in hundreds of ortho practices, hundreds of dental practices, and I can 100% guarantee that 99% of the doctors that are listening, if you know how your financials are being presented in the first place, that's the first question I would ask dentists. Do you know how your financial coordinators or your treatment coordinator, if you have one, or if it's your front desk person who's presenting financials, do you know how they're presenting your treatment fee options? 2 is I can guarantee that the majority of practices are starting with the treatment fee first. So whether it's 5,000, 6,000, 7,000, they're saying your treatment fee is $6,500. Your insurance will cover $2,000. If you put a down payment of $1,500, your monthly payment would be $600 per month, because we're only going to give you terms till the course of your treatment, and we're estimating 6 months or whatever it is. Opposed to like every other industry out there, nobody starts with the big number first. Everybody starts with the small numbers first, right? So it really just needs to be flipped upside down. You're still providing the same information, just in the opposite direction, right? So if you are going to, provide flexible payment plans and get a payment that's reasonable, let's just start with like $300 monthly payment, because you're willing to extend treatment over 12 or 18 or 24 months. But starting with the monthly payment first. So your treatment fee will be $300 a month. Your insurance covered $2,000 if you put a down payment of this, and then your total treatment or your total investment, or I know, and Stephen and I have talked about the word investment versus treatment fee, but your total investment would be this much, right? And there's a lot of different schools of thought about even saying the 6,500, right? Or your out-of-pocket portion. So if they have really good insurance and it covers $3,000 of a $6,000 treatment, there's no need to ever say $6,000. So your out-of-pocket portion is $3,000, right? But as soon as you start with the big number first, the fee of 75, 85, 65, even if you're 45, the average Canadian or North American, I think the last statistic has about $600 in their bank account. So starting with the number 45 to 65, 75, you instantly are going to lose 80% of your patients going, holy smokes, $8,500. I can't pay that. I barely have $1,000 in my bank account. So that would be the first part, is just flipping the model upside down and starting with small numbers first. And the second,
can I just jump in here, Chris? There's something, I'll just put a bookmark in for the moving past this, but
yeah.
I think that what you said makes so much sense, because when we're talking to the patient about their crown, and let's say we do send off for a predetermination and we find out that they have coverage at 50%, we normally aren't going to them and saying, hey, your crown is $1,500. Instead, it's going to be more as your portion of this treatment is going to be, and you have two insurances, it's going to be $200 for this crown. That's kind of where it starts off. And then I think if that number looks really, really good, then you can go ahead and you can say, oh, yeah, you have an excellent situation here because your insurance is actually paying off X amount. But if it's something like, so if you're paying off almost all of it, I feel like saying like, oh yeah, you've actually got $6,000 worth of coverage here. So your patient portion is only going to be $1,000. Sweet. Like then I would hit that number. But if it's going to be somewhere in the middle where it's like it's paying off $1,500 and you were going to charge $7,000, then I think you could present it like you said as like, oh, your patient portion would be $3,500. And you don't necessarily need to dwell on the total cost, but 100%, you never would say, hey, patient, you're like the crown costs $1,500. Oh, and by the way, the insurance covers $750. Like you present it the other way where it's like, oh, your patient portion is X. And then if you want to give them the rest of that information, if it's relevant, oh, and just so you know, your insurance is paying Y and your total price was Z. But this is something that I think doctors, because what I'll do too, if Chris doesn't present this, I'll go ahead and show exactly how we kind of approach it.
Go ahead.
Well, I'll let you finish first because I think you have more insights into even a step beyond what was just said here. But I feel like this is like the easiest thing to do right off the bat. Like you don't need to change, even if you wanted to do all those same numbers, you just flip the order. But I think the way that really, really has value is not forcing them into a certain, like, this is your monthly payment, this is everything else. And that's where I think you're probably continuing to go. So I'll let you keep talking and then I'll jump in with insights.
Yeah. Well, I think that, if you don't know, the two biggest barriers to patients moving forward with treatment in terms of the financial component is one, a required large down payment. And two, high monthly payments, right? Even if you're willing to provide terms or payment terms for your patients. And there's some offices that don't, and they typically don't get high acceptance because either it's, I'm offering Invisalign at $5,000, you have to give me $2,500 before treatment and then $2,500 at the beginning of treatment. Well,
it's a year.
I see it I've seen it quite often.
Oh yeah.
I think it's changing slightly. It's very common because one, and I do understand from a cash flow perspective is that, Invisalign lab fee can be, if you have no discounts, you're looking at $2,300, right? And a lot of offices want to get their lab fee covered right out of the gate. That's, in my opinion, if you want to start to get higher patient acceptance, one of the areas that you need to look at. You need to bring down payment down significantly, but you also have to have options. As consumers, we all like to have options for purchasing anything, right? And the one thing in Canada is we don't have very good third-party financing. It's improving. I think there's one called Lending Point. Is it Lending Point?
Lendcare?
I think they just
Lendcare.
Hum apparently is a newer one too. Anyways,
well, I think in the US they stopped, but I think they're different but anyway, so yeah, there are some options that are improved, but I always blew my mind that practices are willing to interest free for a certain number of time. But if the cash flow is there, it makes a lot of sense in terms of being able to bring patients' monthly payment options down, because again, patients don't typically have, the average Canadian doesn't have a lot of money in their bank. So if you say every month you got to pay me $500 or $600 or even pay the remainder of the treatment, your acceptance for treatment is going to go way down. So what I have seen work really well in my time in orthodontic practices, but also dental practices, one, flipping the model upside down in terms of presentation. Two, is super, super important that whoever's presenting the treatment believes that the treatment is valued at that amount. Like there's nothing that's going to kill your acceptance rate when you have a financial coordinator or a treatment coordinator that goes, so the treatment fee is $6,500. I know it's expensive. Like done, right? Patients, they have to
yes.
value is there because it is, right? You're giving these patients an option to have their teeth for a lifetime. Um, but the other big part is just providing options in terms of financials and how you verbalize it. Kelly, you mentioned that numbers are not your thing. And if you start throwing, every option that you have at them, then you're going to lose people, right? We really want to make it as simple as possible for the patient to understand, because a lot of times you have the mom with the kid, if you're treating teens or younger kids, and most of the times they'll want to go home and explain it to their spouse, or vice versa, the dad going home to explain it to the mom. If it's complex, they're not going to be able to explain it properly. There's going to be, less acceptance. So I've always been of the mind that, and I've had a lot of practices take this on and do it. I think Stephen, your practice does it now too, is almost like create your own adventure. I don't know if I'm dating myself here, or those books where you get to
those.
Look, Steven doesn't know. I know.
I know. Those are great.
Your own adventure, right? And just presenting it in a way that patients have the option. One is putting the patient in control when it comes to financials, right? Giving, whether it's the perception of control or they're able to make decisions and not be felt like they're forced into something. So one is down payment, right? Having your lower threshold. Let's say that the lowest down payment you're willing to take is $500. Then asking the patient, what are you comfortable putting down today as a down payment, right? And stop. Don't say a word. And it's called the pregnant pause in sales. But let the patient think about it. If you have a payment slider, this is also an option. There's some apps out there. Maybe we need to create a clearly aligned, app for payment.
Ooh.
Right. So there's lots out there, and certain companies have them, but a lot of offices aren't using them. But if you give the patient the control to, set their down payment, they can see the changes in monthly payments, right? They feel like they're in control. And what you'll probably find is patients will often give you probably more than what you expect, right? And not making assumptions about a patient and what they can afford and what they can't afford is a whole other thing. But if you have your monthly or your down payment threshold of $500 or $200, or maybe you'll even be willing to go to zero down to start treatment, and that's going to blow people's minds. Like, what do you mean I'm not taking a down payment? But I can talk to that strategy in a second. Mm-hmm. But once a patient feels like they've been able to say, I can put down this much, they feel more comfortable with it. Right. Mm-hmm. As soon as you tell a patient you have to put 1,000 down, 1,500 down, then they've lost control, and sometimes they may feel sold. On the other side of it is, usually you'll have an option to pay in full. With most offices will give a 5% discount if you pay in full, and then offer you monthly flexible payments or monthly payment options, and whatever the terms may be. I would say most dental offices will allow payment terms to the point of the end of treatment, which they've determined as, which I also find interesting, because a lot of times treatments will go much longer than, especially with new providers, they think. But giving patients the option to have a lower monthly payment is key, right? And if that means going past estimated treatment time, which is still the beauty about being a dentist, is because most of your patients are already patients in your practice. And I know you do this, Stephen. So maybe
we do this in ortho specialty, and they're not our patient. Like when we're done, if we're done in 9 months, and we've financed them over 24 months, because that's the slider they chose. They 24 months was comfortable for them. It doesn't bother us at all. And people just keep paying. It's like a gym membership. They've committed to it. I mean, they're still on our retainer program. We don't make them come in, but we're still their person, and it's completely pleasant. And people say yes.
People they're not out there to screw you. I always say this: no one is like starting their treatment, and then as soon as they get their trays, they're like, okay, honey, like, let's go. Like, you got the like fake IDs. We're off to Mexico to start our new lives together. Like, we got the trays.
Did you get enough elastics to last 18 months?
Exactly. Like, no one does that. They're paying for the result, not for the trays, because we showed the value of our role as the practitioner. it's not just about the plastic, it's about the provider.
Right.
So
You can't trust the plastic. You got to trust the plan and the planner.
yes,
That's what
exactly.
it is.
I like
But
that.
also, if you have such a low monthly payment schedule, you're opening the door that they can treat the second child at the same time. Mom can jump in and treat herself
we do that all
because
the
for the
time.
same $150, you've just explained to her, well, that's less than one family meal that you went out for dinner at Boston Pizza or your Starbucks Frappuccino. Could you do without it?
Yeah.
To get Timmy his new smile. So these are like put some real calculations on the wall in a poster.
Yeah.
And because you don't realize how much money you're spending here, there,
Yeah.
we all have a bit of disposable income.
Totally. Going into what Chris kind of said. So here's how we'd approach it, right? We start off with like you finish the consult and they need to have trust in you from how you finish that consult. And then they see the financial presenter, the treatment coordinator. Or it could be you as the doctor still. When I first started, I did do it myself because nobody else knew how to do it. And I was like, you know what, I can do this. And nowadays, if I had to do it, I could do it very, very efficiently. Like I bet that I could go in there and sell cases because it is a bit of a formula here. Once you know how to do this, then like it's not super hard. Well, our treatment coordinator has been training a new treatment coordinator, and my treatment coordinator has only been in this role for just over a year and a half. And our new treatment coordinator is only 6 months, but they learned some of the philosophies that I've kind of taught them from, like, this is how we present. So how we would present is like, first of all, making sure there's no questions or concerns about the treatment plan. So I'll just take this over role playing as like, Chris, you're the patient, right? So it'd be like, hey, Chris, so you just had your visit with Dr. Schulk. Is there anything that was unclear, or is there anything that would stop you from moving ahead with treatment based on anything you talked about with Dr. Schulk? No, it was really great. Everything seemed like, I'm really impressed that I didn't think you could fix my teeth with Invisalign, but I saw someone like me. So yeah, I'd really like to do it. Or, well, I'm worried about the whole wearing retainers part at the end. He didn't really talk about that much, but he said I had to wear retainers for life. So you want to address that point first before you move into the finances, because again, there might be a barrier that you need to remove. You might waste not 3 hours, but you might waste 20 minutes talking about finances when they're not going to move ahead because the retainers component was a deal breaker, right? So solve that problem, bring the doctor back in, or if your staff know how to answer that question, okay, clear that up. Now, do you feel good about the fact like you understand why you have to wear the retainers and the value for your grinding and chipping and wear? Yeah, I do. Okay, cool. Anything else? Nope. All right. So Dr. Schulk gives me a lot of flexibility to come up with a plan that's going to work the best for you. Now, taking a quick break from our role play, what I'm thinking of the analogy I have is if anybody watched Price is Right and they had that game Plinko where they have the little like wooden chip that falls down, it hits all the pegs and then it lands in the 10,000 in the middle, or it goes all the way out to the sides where it's worth 0 on the far end or something like that. But my goal is as long as they're landing somewhere on that Plinko board, I don't really care where they go. And I want them to have the freedom and the choice to find that plan. And again, this was all brought on from conversations with Chris. So Dr. Schulk gives me a lot of flexibility to come up with a plan that's going to work best for you. Some patients choose to pay in full and receive a discount. Other patients prefer a monthly payment. Do you have an idea of which direction would be best for you? And they're going to know. Either it's going to be like, oh, I pay for everything in full, or, oh, yeah, no, I wouldn't be able to pay in full. Okay, awesome. No problem. Do you have an amount that you'd be comfortable with as a down payment? Yeah, I'd comfortable with $3,000, right? You guys, many of you have heard me say this already, but $3,000, awesome. $2,000, awesome. $1,000, awesome. If it falls in your parameter, if you're comfortable with $1,000, if they come in and they say anything over $1,000, it's just like, oh, sweet. Okay, move on to the next part. If it's under that number, let's say it was 1,000, then you'd be like, okay, well, the minimum we can do is 1,000. The patient might be like, okay, yeah, I can make that work. Or they might be like, ooh, like you'll see it. I think I only have about $500. Okay, well, can you work with that? Can you say like, okay, well, let's do 500. And then before we order the trays, we'll do another 500 in a month, right? Like then you can start being a problem solver. You're a detective and you're finding out what's the barrier. And ideally, they just fall in the category that works. And for us, we've gone right down to $0. But let's say you're 500 or 1,000. Okay, cool. But you're going to find that like 80% of your patients will fall in the acceptable category, and only 20% you either need to move them into the acceptable by helping work with them, or you move your criteria back a little bit to fall in their category if you are comfortable with that. Okay.
Yeah.
So $1,000 down. Awesome. Great. Okay. And now you need to look at, as a doctor, how comfortable are you with your length of payment terms? I would recommend everybody should be comfortable with 24 months, especially if they're an existing patient in the practice. There's lots of different ways that you can get more aligners so that you can continue on, even with no attachments on the teeth, at the end of treatment before you give them their retainers. So there's lots of different strategies to make sure you don't get screwed. But Chris said to me, and Chris, do you know what that statistic is? What percentage of patients default after the 6-month mark of treatment? What was it?
Yeah, so it's actually less than 10%, I think, based on gauge data. And that's, I think that's probably one of the biggest concerns from doctors is if I extend payments or I take a low monthly pay or down payment or low down payment, that people are going to default on treatment and run away with their aligners. There's actually no data out there. And there's large organizations like OrthoFi and Gauge that deal specifically with orthodontists across North America. And these doctors are all providing extended payment terms past, 36 months past the course of treatment. And so the statistic is actually, if someone's going to default on payment,
it's in the first 3 months. Leanne was at the Canadian Ortho Association. She presented Gauge, and obviously she's amazing. Yeah. She had that data. It's usually, if they're going to screw you, it's in the first 3 months. So you're going to know. So whatever, at least you haven't committed your chair time. So you've lost some time.
So that's similar data to what I saw. So it's in the first 10% of treatment, right? Mm-hmm. That 50% of patients would default, and then the remainder will be before the halfway point of treatment. So if they make it past the halfway point, they're going to pay. So getting someone to treatment and so depending on what your strategy is, if you're worried about them not paying and using kind of passive or active retainers before they give them, that's fine. But I think you're good once a patient gets to that point. They're happy, your retention strategy. But there's really no data to suggest that patients are going to default. And the other part of that data that came in is even when a patient does default on treatment, on payment, the average amount collected from those patients is still about $2,700, right? So you're still paying, you're covering your cost of the lab fee. You're not really losing. But what you're gaining in offering the ability for patients to pay over longer terms, you're lowering the monthly payment into a place where it's affordable for the patient, and you're increasing your overall acceptance. So default's going to happen, right? If you're going to do it, it's going to happen in any industry and even in dental, any treatment, if you provide any kind of payment plans. But you have to look at, if I was able to start 10 more patients and I got one patient.
Yeah, I'll jump in with the analogy. I use this when I lecture all the time. It really strikes true. If you had a family of 10, they walked into your practice on Monday morning and you had the capabilities of treating all 10 of these family members. And they said, hey, here's the deal. 2 of us will move ahead if we have to pay in full. But if you go ahead and you give us flexible financing terms, all 10 of us will move ahead. If all 10 of us move ahead, we want to have a discount of some kind, right? And so that they're good to move ahead. They're solid. You're going to get this money. Just assume that. How much would you discount in order to get 10 cases? And you're charging $7,000 a case. Like, you're charging full boat for all those cases. How much would you be willing to discount, or how many cases would you be willing to do for free? Like right now, I think a common thing would be if you had a family of 5 and they wanted to move ahead, like you do all 4 of the kids, I'll usually treat the parent for like cost of just the aligners, or even for free if they're going to do all 4 of them, because like that's a lot of money at $7,000 per case at 4 kids, making $28,000 in one consult. Like, yeah, I'm not going to be like, oh, I could have made $32,000, right? Or something like that. So in that situation, I've surveyed hundreds of doctors, and the common response would be is that I would go ahead and give 1 or 2 of those 10 cases for free, right? And you might not agree with that, whoever's listening right now, but I think that's pretty common that you would give some type of a discount in order to get those 10 cases. So let's say now instead you have an Invisalign day coming up next Saturday, and you have
10 patients coming in, and they're all people who are kind of ready to move ahead with treatment. They're all wanting to do it, but that 2 of those patients or 1 of those patients is going to default on you and not even pay you 1 cent. But you're going to get the other 10. And if you ask for pay in fulls, you would only get 2 of the 10. But if you give financing that's flexible, that 8 out of the 10 will pay you, or 9 out of the 10 will pay you. Well, what's the difference between those 2 scenarios? You still got payment on 9 out of the 10 cases, and 1 was free that you gave, and 1 was one that somebody screwed you on. But would you be willing to do that to increase your case volume? And if you look at the numbers, the reality is like everybody should do that. So if you want to never get screwed on a patient not paying you for something, for treatment you shouldn't do any dentistry. You shouldn't do crowns, you shouldn't do bridges, you shouldn't do root canals unless you collect every dollar in full the day that they do it or before you even do the treatment. Nobody does that. Or very few of you. You're very lucky if you can, if you're in that bougie of a practice that you can do that. But the reality is that you will have some clients or patients or customers. If you're in business in any sense, there's going to be a time where somebody's going to owe you at least $5 that you're not going to collect. And you have to be okay with that risk. But it's also why we get big reward. And so that's always my analogy.
Too, I think like I think I can only think of 2 times in my whole career, and I've been obviously in ortho, so just ortho related, where people had to end treatment or they couldn't pay anymore. And so some were in fixed and, some were in aligners, but they were real problem reasons. Like we felt bad for these people. Like, it was like loss of job, sickness, rehab. They're not out there just to be like, oh my God, I got my aligners and run, or, doing home adjustments. Like, so really, for the most part, there's people who might just take off or they move countries and it was an afterthought or whatever, and they're just forgetting about you. But for most of the time, we just continue to treat them, to be honest, because like, what's the alternative? Like,
yeah, I think 2 things. One is you have the ability that you could do that. Like we've had somebody before who's like their child got cancer and they now have to relocate to a different city, and both of the parents aren't working anymore. And it's like, okay, like, geez, this is heavy. I'm not going to not treat them. Like, it's just like on an altruistic aspect, I'm going to keep treating them and we'll figure it out later type thing. Yeah. Like we'll figure this out in the next, like in 5 years, this is like, you can let us know and we'll sort this out, or we'll just write off the whole thing for you.
That's good karma. That will come back with 10 more patients.
Totally.
For sure.
And then the other aspect is that I've had a patient who is not the most reliable, and she is one of the ones who wasn't paying us. She was on Facebook Marketplace looking to buy a mini goat and complaining about how she doesn't have any money all the time. But here's the strategies. Like, again, this is just like a little, like, we're dipping our toes right now into the info. And if you like this, take Foundational Systems of Clear Aligners by Clearly Aligned, and you'll get like every strategy to make sure you never get screwed on the funds. So we go ahead and we hold all of her trays then at that point, and she gets the choice of whether she wants to pay for her an individual tray for $100, gets her an upper and a lower, or she can make her monthly payment and she gets 4 sets. She's changing once a week. It took us with this particular patient, she owed like $4,000. It took us kind of like moving through this very slowly over the span of quite some time. And her treatment was then tied to her finances because she showed that she was unwilling, like she wasn't able to make her payments. And she didn't come to us to tell us, I can't pay. She just stopped paying us. And then we had to kind of track her down and say like, hey, what's the big deal here? If she had come to us and said, hey, I'm in a tough financial spot, we would have said, let's work on redoing your contract. The main thing is you always want to make progress towards being paid off. Yeah. Because she didn't take the adult responsibility of telling us and we had to do the work, then it was like you've lost the privileges. But lots of patients will say like, hey, my husband lost their job. Can we change the financing terms and extend it over longer? Absolutely. Thank you for coming to us. In this case,
like during COVID, that happened to all of us. Like our ortho practice, I swear to God, I don't know if it was like 30 or 40% of people. We didn't collect payments from any of them. We still continued the treatment, albeit 8 weeks was remote, but we still continued to treat in that direction. And then we caught them up, but that was like, real life problems.
Yeah, totally.
We all had them.
And what you do then is exactly what you said there. Like we did the same thing. We gave patients the flexibility to defer their payments. But then in this situation where we know she's irresponsible, we know she's that 1% that will screw you. Because again, I want to give these real life strategies for you guys listening right now so you can know how you don't get screwed. Because I don't even want to be screwed 1% of the time. right?
Yeah.
And we aren't. And so what we do then is it's like, hey, we keep all the trays. You either make your monthly payments or you buy one tray at a time. You slow down their treatment. It's taken her way longer to finish, but now here we are, and it's been like another 2.5 years, and she has finally reached the point that she's finished paying it off. And it's very rewarding to be like, wow, we managed to do that. One point to know is that we did not have her come in for an appointment to get those trays. She came in and she just made a payment, and then we'd physically give her the trays. And we actually put things to the extent that we said, you can either e-transfer us, but it has to be before you come into the practice, or you can come and you can pay in like cash at the practice or on a credit card at the practice. But we kind of separated out the digital payment, like the predetermination, because there's one very big caveat I want to make to everything we've just been saying. Very, very, very important, which is, and we'll talk about lending care in just a second here with Chris, but you have to make sure that your patients are set up on some type of pre-authorized payment system to do this. You cannot have them coming in and making payments every month with a check or with cash or paying in person with a credit card. They will forget, they will lose track, they will stop paying. So patients have to be set up on some type of pre-automated system that comes out, just like your Netflix that you've forgotten about, so that every single month it comes out of your bank account or it comes off of your credit card. But if you rely on people remembering to do it, they will let you down.
Yeah. And I think that's the difference. Like in ortho specialty, like, we take the payment, it's all set up and you never hear about it again. And that's why they like to see you, because it's not attached to money every time and stop by the front desk and you hate that woman at the front desk and all that kind of stuff. So yeah, just get rid of all that. That's a hassle, except for this goat woman. I mean, I don't have patience for her. I would buy her a goat and write her off. I don't got time for that. $4,000. I'll pay your $4,000. Get the heck out.
Out of my office.
I'm done with her.
Totally. Yeah.
I have zero time for her.
There's my long.
Yeah. We can't fire her patients, though, technically, legally.
But but it's not a big deal in some sense, because it's like all we did is for these very few particular patients, we now tie their treatment to their payment, or we tie that together. And it's just, I still don't see her more. It doesn't really matter to me. It's kind of just like, hey, we have it on her file. When she comes in, she makes her payments. Here you go. Like, we accommodated that situation for her. And so she's very grateful about it. But also we've still managed to make sure we got paid for everything.
Yeah.
Yeah, it's interesting in the world of dental and even medical is that you'll often take the very few exceptions and make that the norm, right?
Okay,
So even though you have very few patients that would actually default on treatment on purpose, there's some that, like Kelly said, have financial situations or personal situations that you want to help them, but the fact that you'll cater to the 1% when 99% of your patients are going to pay, and look at the 1%. I would look at the 1% as an investment, and because you can write it off in your company anyway if they do default in terms of bad debt. But the amount of growth that you'll see by being more flexible in payment terms, and just to give you another statistic, I think what the average monthly payment, the kind of sweet spot, is like $250 to $300, right? So if you were to take a Invisalign treatment at $6,500 with zero down and run that over 24 months, you're looking at $270, right? And so you're right in that sweet spot, assuming they don't put any money down and they have no insurance, right? So having that flexibility, and I'll add one thing to your consult that you mentioned. The one thing I would tell the TC to maybe ask as well when they're asking those questions is, is paying in full an option for you? Are you looking for a monthly payment, a low monthly payment option? Is, if they do say the low monthly payment option, then to actually ask, well, what would be a comfortable monthly payment for you? Right?
Because I didn't get to that part, did I? I got sidetracked. Sorry, everybody. Yes.
Yeah.
So going back to that, then once they get to that $1,000 that they said they're going to pay, going way back. Then let's
say it's 500 down, because we don't want people to think 1,000 is normal. Like 1,000 would not be normal.
500 down or zero down. Then
zero down. I'm happy with zero.
Yeah.
But
then the next thing that the treatment coordinator would say is, do you have an amount that you'd be comfortable paying each month?
Yeah.
And from that, then it's whether it falls in that category of what you're comfortable extending those payment terms over. So if you're like, you know what, I'm cool going over 24 months, like Chris just said, if they say, we just said that was 275, is that right, Chris?
Yeah.
270.
275, whatever. So if they come in and they say, hey, I'm comfortable paying 400 per month with zero down. Okay, cool. Let's do this.
Yeah.
If they say I'm comfortable paying $50 a month, now we might need to look at some other options like LendCare, or we need to tell them like, no, that those numbers aren't going to unfortunately work. I know one, Peter Braun was just telling me about a Japanese orthodontist who puts his treatment costs up to 10 years. He charges like 3% interest or something like that. But this is crazy, but he starts like 5,000 cases per year because the monthly cost is like $75. Now he's playing the long game.
Yeah.
But-
and for millennials and people who, they want it to fit into their lifestyle. And so I don't know. It's like bread and butter money.
Yeah, if it was
Kind of
$75 over 10 years, right? Like then I'm not saying you should do that. That's a lot of work to track for 10 years and whatnot. But yeah, as long as it falls within those parameters of this Plinko game, then if they've come up with the amount, they've said, okay, I'm comfortable doing 1,000 down or 500 down or whatever down. And they've said, I'm comfortable doing this much per month. As long as it falls in those criteria for us, we say, okay, go ahead. Like, let's do this. And it's hard for the patient then to say no. If they said, I'm really happy, like you're the patient again, Chris, the patient. I'm really happy with what Dr. Schalk said. I didn't know you could fix my teeth. Oh, finances. You go through it. You're happy with all the different terms. You've come up with it. And we say like, okay, how do you not move ahead then? Like we just agreed to everything that you needed in order to remove those barriers.
Yeah. Yeah.
And if you pre-thought this out, because I mean, again, I hate numbers. So if I was a TC, I would do the same thing, like, sliding scale, blah, 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 blah. But I would have preset, hey, these are the most common packages that people choose. A, B, and C, like whether it's 0 down, 500 down, and blah, 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 or pay in full. And then it's just easy. Like Invisalign production days, we've got it worked out because we don't have this big conversation. It's like, you already know it's a discount
You're
today.
almost letting them know that they can be anywhere on this sliding scale, but you're giving them like, these are the 3 most common, but we can work with it in any way that you want. Chris, what you were just going to give some insights.
Yeah, I personally, just from a sales perspective, don't necessarily want to put them in a box, right? You're giving them too many options. You want it to be as simple as possible. Like in an Invisalign production day, they know they're coming there. They're probably ready to move forward anyway. There's already been conversations in the clinic. But having those options where they can look at it. But in a consult situation, I want to keep it as simple as possible so that the patient doesn't have all this stuff, the numbers going through their head, right? And as far as the, and I lost my train of thought there just as we were talking about that, but
so like to do up the paperwork for that, like the paperwork. So you've got this down and for the insurance and whatever. So you do the sliding scale, you do the down payment. I'm just thinking of your TC who's printing out all this stuff. If you have a million options.
Yeah. This is kind of how we do it. Our TC, sorry, keep going, Chris.
Yeah. I just, the thought that I had was, well, why don't you talk about how you do it?
Sure.
Because it probably tie into that.
Okay. So what we would just do is we have like essentially just a blank form now. It just doesn't have anything on it. And then you kind of ask the patient, like our TC's got a calculator right there. She knows the cost is $7,800 all in. We need to get to that number somehow. Ask the patient, they say 1,000. So she goes on the calculator that the patient can't see, 7,800 minus 1,000, 6,800. Do you have an amount that you'd be comfortable with? $300. Okay. So they go 6,800 divided by 300. That's going to be what? 22, 21, something like that. So it's like, oh, it's 21 months. Okay. So she writes down on the sheet, 1,000 down, $300, and then looks at the calculator. It says that it's going to be 21.7 months. So she's going to put over 22 months or whatever. And then the last payment's going to be slightly different, or maybe I guess that adjusts the number. So it's not quite 300. Instead, it's going to be like 200 and whatever, $97 over 23 months, 22 months. And so it's super easy for your treatment coordinator, because then she's like, okay, if there's no insurance involved, then it's literally like turn it around to them. And it's like, here's your financial terms. And then again, whether you want to then have at the very bottom, $7,800 written down, we do. We want to make sure that they still kind of see that. But then they're like, okay, sign here. Like this is how we can move ahead. How do you feel about this? And that's so fast for them.
So they do it right in front of the patient, right? So they don't ever leave the room to print anything or anything like that.
You should be able to do that. Like the whole conversation, the goal would be is that your financial conversation, we're simplifying this down to be like 3 minutes long, right? Just summarizing one more time. Any barriers or issues from what you heard in the consult on the clinical side that would prevent you from moving ahead. Number 2, anything, or Dr. Schulk gives me lots of flexibility with financing. Then number 3, okay, you just gave me all these terms, turn it around back to you. Here's like the adventure that we just chose together. How do you feel about it? And then usually it's kind of like, yeah, that's doable. Okay, let's go ahead and start the paperwork right now. Sign at the bottom here for this is your financial contract. Okay, here's your Invisalign terms. Go ahead, we'll go through those and sign those. Okay, now let's go ahead and we need to get the pre-authorized banking form completed. And the goal is like ideally, we're looking at 20 minutes for a pay in full, like everything from start to finish. 20 minutes later, they're in the car being like, wow, they really have their stuff together. And again, it shows that trust because you're so well organized in terms of how you're doing this and you simplified that whole process.
Yeah.
Then they leave and they're like, wow, I really trust them because like, boy, they sure had their act together on both sides.
It seems like they've done this before.
Yeah, exactly.
Yeah.
Thank God.
The one thing I would add into that is prior to putting all the numbers into the calculator and presenting to the patient, if you're asking the questions about what would the down payment be that you're comfortable with, what would be the monthly payment that you're comfortable with, and just throwing in, if we're able to do this for you, and you're comfortable with these numbers to what you said, we have the ability to start you today. Is that something you would want to do if we meet all these numbers, right? Or fall into what you've...
I wonder, do you need to preface it with that until you get after the numbers? Because I kind of feel like I kind of take the opposite approach that if you go through it all and everything, like rather than having kind of that like whole like precursor before you present the numbers, would you be comfortable starting today? They might not be because they're like, oh God, like if you were asking me, I'd be like, I don't want to commit to saying yes. So I'm going to say no because I don't want that commitment until I know anything.
Right.
But if you presented the numbers to me and I'm like, holy crap, this is a steal of a deal. Like they're giving me everything that I want financially and the doctor was great and I feel good about things. Then they don't need to kind of like be like, I know I said no, I wasn't comfortable starting today, but I am. Like they need to, I don't want to say like, it's just that change of opinion. So that's why I think if you present the financials first, then I would just almost assume that they're going to start today. If they continue to give you the yeses, you just keep going with it. Like, okay, so are you comfortable now? Like you're happy with all these terms. Let's keep going.
So the verbiage is a bit different. I didn't say, are you comfortable starting today? Would you want to start today?
Would you want? Sure.
Right. So, but it's actually it's in sales. It's a pre-close. It's pre-closing so that you can identify if there's any other objections. Right. So is there any barrier still existing that is going to stop them from moving forward other than financials? Right. They've said, I can put 500 down. I want to pay 250. If we can set up your flexible payment plan, because Dr. Shaw gives me this flexibility, is there any reason why you wouldn't start today? Like, or would you want to start today because we can? Right. I think it's important to let patients know from a same day start perspective, but
that they're not
again,
inconveniencing
Same day start in aligners is more like Dr. Shulk will be starting to plan you tonight.
Yeah.
Because we're not giving you anything. In Fix, we used to strap you up right on the spot.
We can get you started today, and you'll explain that, right? But it really means we press go today, and that means you start your treatment sooner.
Yeah. No, I agree with that.
It's comfort level.
And I think what you just said is what I've been trying to get the TCs doing more too, which is now that you've given us the yes on the plan and yes on the financials, are there any other barriers that prevent you from starting treatment? I love that, what you just said, right? Then then that can be extended to process your financials and to do it to get going today.
Yeah. Yeah, but the way you guys do it, I think, well, obviously we've had lots of conversations and you guys have modified things. And I think the only missing piece here that we haven't talked about is third-party financing, right? Because, well, there's another part too that I was going to mention. So I think there's probably a lot of doctors out there that if we're talking about low down payment, so we're saying, because typically what I've seen across the board is most dentists want to get their lab fee up front, right? They don't want to be in a cash flow negative situation. But that's going to impact overall patient acceptance. So how do you get around that, right? If you offer options in terms of pay in full with a 5%, I've even seen some offices go up to 10%, right? It really doesn't matter. You can adjust your pricing to offer a higher, there's ways around that. But I guess I think the way to look at it, if you're a dentist that say you're starting a new practice, and obviously we know that anytime you're starting a new practice, cash flow is king, right? There's a lot of expenses coming out, or you're in a situation where you've made lots of capital purchases and cash flow is a little bit tighter, and you don't want to have that, expense of the Invisalign lab bill, which, realistically, if you do scale quickly with Invisalign, that and Stephen knows this, you get squeezed really, really hard. So what I would say is, look at it from kind of as an offset situation. You obviously your goal is to get a higher down payment, right? If you can. But if you have patients say you had a patient that is willing to pay in full, and what would you say the percentage of patients that pay in full in your practice are? 10%?
Probably be something like that.
Right. So, you get one patient out of 10 that pays in full, but now you have the ability to start 3 other patients at 0 down, right? You've covered your lab fee with that pay in full. So if I was a doctor that was, concerned about cash flow in my practice as a new practice, or a situation where that was, then I would kind of look at it as like, okay, we started a patient that paid in full, and now I have a little bit more flexibility for the next 4. So let's focus on making sure that we're flexible in that situation, right?
Yeah, and taking that one step
that way.
further, then what you can do is that, let's say you had that one pay in full, because someone might say, but well, I was always going to get that one pay in full, and I need that money to run my practice, to pay my assistants and do all the other things, not to pay my other lab bill. I was just talking with a friend about this, where they're not even a new provider. They're like a platinum. And they're like, hey, Steven, I'm having a bit of like a crunch right now with my lab fees. Do you have any advice? How do you manage this? And my answer to him was, well, right now, like, what's your pay in full? Okay, it's 1 in 10. Okay. Are there things that you can do that will allow you to get more people paying in full? Because what's your lab fee right now? Oh, well, as a platinum, I'm $1,500. Okay. So how much do you charge per case? This doctor does really high quality treatment. Again, they're on the same philosophy as we are, where they charge like $7,000 to $8,000. Okay. So if you can get another patient, if you can get 2 out of 10 to pay in full instead of 1 out of 10, because you made the offer more enticing, and you might need to present it slightly differently. You need to kind of guide those patients towards, like, some patients choose to pay in full and receive a discount of $1,000. Other patients choose to da-da-da. Right? So that was my recommendation was, okay, instead of charging $700, $800, give $1,000 off for your pay in fulls. Only do it until you've met your cash flow requirements. So if you're $1,500 and you're like, okay, well, I'm really getting this crunch, and you just need to pick up 1 extra pay in full for every 5 cases that go ahead, because $1,500 times, instead of $7,800, it's $6,800. Let's just call it 7,000 for easy. Then that means that you've got 4 cases. 1,500 times 4 is 6,000, and you've got an extra 1,000 left over. You've got 4.5 cases ish. Now paying off that lab bill. So you just need to get 1 more patient for every 4 to 5 paying in full. And yes, you're losing the $1,000, but I'll make the argument back that by having that $1,000 in your pocket sooner, or by having the extra $7,000 in your pocket sooner, you now are in a position that you can, like the value of money over time, right? You're not paying off your own debts on a line of credit at 7%. So you do the math on that, and we did it together, and he was like, holy,
like, I didn't realize this was the way it actually worked out. It pretty much worked out exactly the same. That $1,000, the extra money he had in his pocket, saved him over the 2-year span about $1,000 worth of interest payments if he had on a line of credit with current rates. So I think you dial that in, and then if you're now at a point where you're like, okay, I got that extra pay in full, like I'd even go $1,500 off if you need it for the cash flow. Like your immediate need right now is not profitability, it's cash flow. So take $1,500 off your case. I mean, hopefully this doesn't seem too sneaky or sleazy or anything, but the other thing you can do is I would rather have my prices be higher and take off prices. So you might say like, well, Stephen, I only charge $5,000 per case right now. I can't give $1,500 off. That doesn't work. Well, then you might need to consider having your entire price point slightly higher so you have the flexibility to give some discounts to get that cash flow, because maybe those numbers don't work for you because you're saying, well, I pay $2,300 and I only charge $4,000 per case. That's my whole argument to you here of, again, and I can't remember if it was this podcast or our last one, where we talked about my ultimate goal for you as a provider is not just making gross income. It's about profitability. Right? You can make, you could charge $3,000 per case and pay out $2,500 for your expenses. You're not making any money. I want you to make money. And the way to make money is to do better treatment with better consults with patients who trust you, who feel comfortable with you, and charge amounts that are going to make you money and then gives you the flexibility. I don't want to be that hustler who's a diamond plus, who's only making $500 on each case. So
you're just spinning your wheels. That at a certain point, you have to ask yourself, why? Why am I doing this? It's an ego thing.
Yeah.
Or it's just you don't know any other. You also don't know any other way. That's kind of what's been presented.
No
one's presented that you can charge $8,000 in downtown Toronto, as our one friend is doing, and make money. You can charge, my other friend who I'm talking about is in Vancouver. You can charge $8,000 or more than $8,000 in downtown Vancouver. You can charge $8,000 in Grand Prairie. But
attract the cream of the crop and do excellent work.
And all the things we just said with the strategies of it all kind of goes together, right? We only can do that because we don't tell them they have to pay in full, and because we give them financing that goes over 2 years. That allows us to then go ahead and decrease the price for the pay in fulls.
Yeah. And I think you hit it on the head. And I've been, to every major city, in practices across Canada. And there are certain ones that seem more competitive, and it's really interesting. Downtown Toronto being one of those. You'll go to one area and everybody is charging $4,000 for Invisalign treatment because every other office on the block is advertising that. Whereas you go one block further and they're charging $8,000 in a dental office, but the orthodontist one block away is charging $6,500, and it doesn't make a lot of sense. And I think the point of this whole conversation is really, again, back to affordability versus cost. If you charge $4,000 or $4,500 for Invisalign treatment, but require your patient to put $2,500 down and then pay the $2,000 remainder once they start treatment, versus if you charge $6,500 and offer zero down and they only have to pay $270 a month over the next 24 months, which one is more affordable?
Yeah.
It's not so much about the price, and you want to be offering your treatment at a price that makes sense, that you can be profitable and cover your expenses. Like I don't know, this is just my opinion. If you're treating patients for less than $4,000 on Invisalign and you're paying $2,300 for lab fee, I would say don't do it at all, unless your strategy, and I do think there's strategies for that particular reason, right? If you do a lot of restorative and it's a pre-restorative thing, or if you're a new practice and you're trying to pull patients into your practice and learn as you
or if you're just so highly efficient and you have your system so locked down that you could offer it that low, but you're really not, like you could do that. Like Stephen, you could do that. You could totally roll people through at that price point and still be very profitable, but you're the exception.
Totally.
Right?
Yeah.
That's the exception. There are some people in Canada and the US who are like that, but they have got their systems locked down, their treatment plans locked down. They're putting very little daily mental effort into the systems because they've got it well baked. We are not all of these people are these people.
Yeah. And
not all of our listeners are these people.
Yeah. And I think what you really dialed in though, Chris, is exactly what it is. When you look at those demographics, I bet if you could go into every one of those practices and you were able to, like you said, look at the different systems. If someone's saying, well, all the competitors in my area charge $4,000 for Invisalign. Okay, is that because they all require pay in full before treatment starts? I would guess quite likely yes. If you looked at the $6,000 ones, the $6,000 to $6,500s, they're probably the ones where it's kind of like, okay, you go ahead and you pay us $1,000 to $2,000 down as our like a minimum requirement, and then you pay the rest out over 1 year. And then if you look at the ones that are 8,000 to plus, they're probably the ones that are looking at, okay, yeah, we'll put it over 2 years, we'll put it over 0 down, we'll make it affordable. And then if you looked at like the extreme end of that situation, like this Japanese orthodontist, he's doing 5,000 cases per year. Like, do the math on
like
that.
him.
That's insane, but he's putting it over 10 years.
Yeah, I'm good. I'm going to live for 10 years, or at least
So,
my children will.
yeah. And,
Who cares? What's the rush?
I think that he probably doesn't face issues of not being paid for the same reasons we just said. And people are very grateful for that opportunity to be able to do treatment they otherwise maybe couldn't do. And so I know that like the average price in certain locations, like Christian Fournier, and I don't know about his financing terms, but I'm guessing they're probably pretty good. But Christian Fournier charges $12,000 for some cases in downtown Montreal. Very, very competitive market. So it's just that thing again, that it's not about the price, it's about how affordable it is.
Exactly. And I guess that brings us to third-party financing. So, we don't use it a lot in Canada. I think there's a lot of different third-party financing organizations in Canada. US generally has better options for patients when it comes to third-party financing. I think the biggest challenge in Canada was that, the acceptance rate was very low. 30% of patients were being accepted, or the interest rates were really high and the terms were very short, right, for what orthodontics requires. But I do believe, there's LendCare is one, and I don't think they're the same company as Lending Point, which had some issues in the US. So I think LendCare is still around. Don't quote me on that. But, there are some other ones, and I know Sunbit in the US is really, I've heard good things about them. But I think if you're a practice that, really you want to offer options, right? And the thing with third-party financing I've found over time is that mostly it's the perception of the doctor or the team members that is the barrier to implementing it. It's not necessarily the patients, right? Because it's maybe the team member feels like, oh no, patients aren't going, well, one, why would they pay interest when my doctor gives them interest free, right? Like if your team members or your TCs don't understand the value of what the third party financing is going to offer the practice from a cash flow perspective, you might as well just not even bother with it. But if you can have that option, right, and maybe you have a pay in full option in the office and you go straight third party financing, and they do have a number of different programs where the clinic can pay the interest, and it's like 5 to 10%. And I don't know the exact numbers here, but if you were going to offer a 5 to 10% discount on your treatment if they paid in full, why wouldn't you eat the 5 to 10% interest on a third party financing if they're willing to sometimes run it over 60 months, right? And bring your patient's payments down to 70, but you get all your cash up front, right? So, I think it's worth looking into, to have those options. I still believe that having cash now, as long as you're good with your money, right? If you get all your cash up front and you all of a sudden spend it all, and then, there's trouble there. And I think that's why a lot of the ortho consultants often recommend that the sweet spot for pay in fulls is about 20 to 25%. You don't want more than that, which I never really quite understood. And then I realized, it's probably because people aren't always good with their money, and also you get all the money and you spend it all, right? And it's nice to have that residual income coming into the practice. But I think looking at third-party financing is a good option. I know there's some practices that I've been into that use it very well, and it actually just gives you one more option to bring that monthly payment option down, but take the risk out of the practice hands, but also take the worry about having to deal with bad debt and accounts receivable.
Well, here's what I think is the holy grail, and if anybody listening right now knows if this is the case, please reach out to me /Chris /whoever, Kelly, And anybody just get in touch, because I really want to know, like, this is how it works from my understanding in Australia, is that the financing companies pretty much have said, we'll go ahead and do, and this was back when interest rates were cheap, so maybe more, but for like 5 to 10% of every case, we'll do financing. And the practice was eating the interest rate of that 5 to 10, like 5 to 10% of the entire case cost went to the payment company. But the benefit of that meant that they got all their money up front immediately. So if they were doing a $7,000 case, they would pay whatever it was between that 5 to 10%. So $350 to $700. So they got between $6,300 to $6,550 immediately, or $650. And so that then meant that they didn't have to have an AR department in their ortho practice doing any of this stuff. So they calculated, well, we're paying somebody $40,000, $50,000 a year doing this, so we're paying $50,000, that's $1,000 per week that we're currently paying. Well, if we get 3 case starts a week and we're looking at whatever, $250, $350 that we're paying out to this lending company or even more, that just is, now we don't need to pay that for our accounts receivable person. And the key is that they accepted every single patient across the board. There was no like, oh, you have bad credit. Like, it was kind of this, we will take every single patient's debt on, and then you pay us 10% or 5%, whatever it was. I would make that trade in a heartbeat. So if anybody knows if they do that across the board, my problem that I've just run into before is when payment companies will reject patients, or if they're charging them like 30% interest. Because they have bad credit. Because where I live, unfortunately, people don't have great credit. And so, but I would just love that. Like, it would be so beautiful to outsource all of the payment aspect of things, and you get paid in full upfront minus the small percentage. And what you can do again is you just plan your case accordingly. If you were like, well, Stephen, everything you said there is great, but I don't want to have to pay $350 or $700 to do this. I would make the argument to you that if you increased your price $350 or $700, that if you were $7,000, now you're $7,700. But now your payment terms are over 5 years or 10 years or whatever they want them to be over. Like, you just paid, like, you got the exact same money at the beginning because you're calculating for that. I wouldn't tell the patient that they're needing to pay that amount, because I think that could cause patients to be less likely to move ahead. Just calculate it into your fees. And then you could still have that statement to them that there's no, because you've just increased your price, they're not the ones paying for it. You could also, which I think Chris makes an excellent point here, is people probably don't care as much about paying interest as we think that they do. You could also just have it partitioned out that they pay the interest to the company that you're working with. And again, everything's outsourced and they're paying that interest. And people obviously pay interest on their car loans. Dentistry is probably the only industry in the world that promotes zero interest at all with financing terms over a longer period of time. So I think we're going to get to a point here where it's safe to start saying, yeah, we charge 5% interest, we charge 8% interest, like that. That's going to change at some point.
And again, it's affordability, right?
Yeah.
If you know, I've heard many times that, well, we can't charge interest. You know, the other practices down the road are not charging interest. But if you're able to make it more affordable with interest, people will pay, right? Actually, at AAO, that same session where I went to the Gauge session and they showed a lot of this data, they did show patient acceptance rates with interest. And it was as high as patient acceptance rates without interest. So it wasn't the patients that were worried about interest, it's more about whether they were able to afford the monthly payments. It's really the perception of and the mindset of doctors and team members that hold that back. Patients are paying interest. We all pay interest all the time, right? For everything that we purchase. Well, not all of us, but you know, there's a large portion of the average Canadian that's paying.
We're not complaining about paying interest on our mortgage. Like, we're unhappy with the rates going up, but we know we have to pay it. So we're used to, with our car payments and anything else, if you're borrowing money, interest is involved. So it's not this foreign concept that people are going to be like, wait, my dentist is charging me interest now? Or the payment company that they're working with is charging me interest? Like, I agree. I think it's something that we're putting this in our own minds, thinking that someone is going to go to the guy down the street because they're doing interest free. But again, if the payment terms, like you said, become so much better, it's more affordable with the interest than it was without.
Yeah.
So
The only other thing around
yes.
the financial part is we didn't talk about, and we're not going to get into it now, is just having as much information about patient insurance as possible,
Yeah.
right? If you're billing insurance and you can provide that information at consult to patients, you know that they have 2,500, 2,000, 3,000 to be able to convey that to them, because most patients aren't going to call their insurance, and definitely don't continue to do predeterminations prior to accepting treatment, right? There's a lot of doctors that want to wait till the patient gets that sheet. So that's a whole other, area in itself, but it does translate into the whole financial conversation piece.
Absolutely. So we made it through. Did we make it through all 5 here so far, or
No,
was there one more left? Where are
there's
we at?
the no time portion, which is, in my mind, that speaks more to efficiency of treatment,
Yeah. We
and
need 3
convenience.
hours of your time. If you're part, if you follow Dr. Schultz, we need the consult. So whatever, let's call that 45 minutes. We need the 45-minute bonding procedure, and then probably the refinement, maybe 4. So 4 hours. Do you have 4 hours in your life to have a beautiful smile, potentially get married and have a good education and a job? It's a good investment.
Totally. Well, I mean, the easiest thing for the time, like I think let's wrap up the time one here. We're running a long podcast. I think we're approaching 2 hours, but I think this one's easy enough, and then we'll call her a day. But the time aspect for patients, like patients, I think once they recognize that treatment is an option, the aligner side, like it's so easy. It takes 22 appointments on average to finish a comprehensive braces case. It takes about 12 if you're doing Invisalign the standard way. My goal would be that anybody who's doing it should be doing it more in like 6. And if you're doing it with dental monitoring, it should be somewhere around like, maybe call it 8 if you were really efficient. And then maybe you'd be looking at like 4 appointments if you're using dental monitoring and you're ultra efficient with how you're doing it. And the goal would be is 3 hours of chair time to maybe 5 hours of chair time would be kind of the averages of when you took all the appointments and added them up, how much time you're using. So yeah, I 100% think that there's really not a lot of barriers with patients once they kind of know how much more efficient the aligners are. I think the key thing of telling them is that if you don't do your part, if you don't wear your trays, or if you're not scanning your teeth, if you're using dental monitoring, you're going to take a lot longer with your treatment, and you're going to have to come in for more appointments, and it's going to be much less efficient. So, and in terms of other things that are changing in terms of time, like Graphy is the new 3D printing company who's 3D printing aligners. The idea is you could do a same day start, because you could go ahead and print their first couple of aligners in office, and then you'd be able to get the rest of them ordered from a commercial lab. And that would allow you the flexibility of doing like a same day start and being really quick on the start. But
Yeah.
I don't know that patients really need that much. As long as they're starting within a month or so, I don't think that matters. With time, the other one of time that seems to matter more so is not having enough time before either a big event, like a wedding. So what I would always counsel is, if someone's getting married and they want to straighten their teeth, and I don't think we're going to be completely done, hopefully we're just done. But if we aren't, then I will tell them I'll take off all of their attachments before their wedding. You have the complete right and freedom to do whatever you want. Like, do not get in the way of a bride.
Yeah.
Take off whatever they want to take off. Usually they take off the front like 4 to 4. If they want to take off everything, I'll take off everything for them. But I wouldn't not start treatment because the wedding's coming up and they're worried about the bumps on their teeth. We can work around that. Any other thoughts on time on your side, Chris, that you've come across being in all these different practices?
Yeah, well, I think time, exactly what you talked about in terms of treatment efficiency, number of appointments. I think that the majority of, consumers, people in our society are concerned about time, right? We want convenience.
How long will they be in treatment for?
Right. And that's part of it, but also there's a reason why we will leave a website within 30 seconds if it doesn't load, because we're impatient, right? We want things, we want them now, we want efficiency. So whatever it is, like as far as the treatment component, being able to convey the efficiency of how you treat in your practice, right? Especially in your example, you're going to be here for 3 appointments, right? We're going to put the attachments on. You're going to come in for one scan, and then we're going to take them off, if that was the case, right? Because we use this amazing virtual monitoring platform called dental monitoring that we use. But I think translating that into everything else, right? So if you're looking at your consult process, is there a way to make it more efficient? When you're talking about finances, are we extending this out and talking about 14 different options, or are we able to condense this down and make it simple because we're concerned about time? So I'll give you one last little story about my own experience with my oldest daughter, who's almost 22 now, who did her braces years ago as she was 13, 14. I wasn't in the orthodontic industry, and I'm fairly type A, and I basically left work to go pick her up from school, to take her to the consult. I had great coverage at the time in pharma. I could pay in full. I'd get reimbursed in full. So for me, it was like, yeah, my dentist said, go to this orthodontist, and that's the only one I went to. And we're moving ahead with treatment, and I just want to get her in, and let's go. And I basically told the TC that, but yet they felt the need to present 3 different options to me, even though I said, yeah, I have good coverage. We're gonna move forward. We're gonna pay in full. Okay, well, let me explain to you the different. I'm like,
because that's their script.
yeah,
Yes.
are you crazy right now? I'm like, so I think anytime you look at whatever process it is, how can you incorporate convenience to your patient? Online booking, right?
Yeah.
I've said this many, many times, right? If you're advertising outside of the practice, for patients, for whatever it is, having the ability, and there's lots of different platforms where you can, block off a couple appointments per day.
Yeah.
And it's the ability for the patient just to find your website and book right there on the spot by clicking a button. That's also time. That's convenience, right? And so I think there's a lot of different aspects where time.
Like even virtual consults. A lot of orthodontists and high level GPs who are doing ortho or any kind of service, really. Especially for divorced parents or separated parents, because mom always has to go back to dad, or whoever brought the child has to go, and that's a waste of time, and sometimes you lose them. But if you can either record it and send it, or you did it virtual, so they're sitting on their couches separate from each other, child's there, maybe the child's at school, because maybe Timmy's too young to understand what you're talking about, and it doesn't really matter.
Yeah.
You have pictures of Timmy's teeth, and you're going to say, yes, I can treat him. The details to follow: come in for a scan, come in for a Ceph. We'll figure out the details later, but there's just so many ways of saving people time and energy, but we get caught up in the old fashioned things we've been doing for 20 years.
Yeah.
Well, I'm probably too having time available soon in the schedule to come in for the appointment. I know a doctor out of Toronto who is a Diamond Plus provider. Their philosophy is pretty much like, get everybody in as soon as possible. And we know that some of them aren't going to show because we have a lot of leads coming in that might not be the most reliable, but we will try to get them in like right away. Yeah. And that will allow us to like beat the time frame of them getting to a competitor, but it means that they need to be more flexible with their office, that multiple people know how to present the financials. Right. So it's not just one person who's overwhelmed. Multiple people know how to check into the insurance to find out if there's coverage for these patients. Multiple people can actually even do some of the like doctor component, quote unquote, right? Where you're showing them on their outcome simulator, this is what things look like, and this is how we're going to bring your teeth, and this is your tooth twin. So
that's what Leanne Panice, she just presented last weekend at the CAO. And she said, any patient who calls, if you can get them in between 2 weeks, that sweet part, 2 weeks or less, even if it's for like that mini consult, yes, we can. Financing, that takes 10 minutes or whatever. So these are all the things, even if you can't get the records or like whatever it is, those are like, okay, so follow up. It's not your normal protocol, but if you can get them in, people will close. And also don't push their delivery, their insert date out past 4 weeks. If you're doing 6 weeks, 8 weeks, they really want it. They just put their money down and then they start getting home thinking, I could have spent that $8,000 in the next 7 weeks on something else, and they start overthinking. So that was really interesting data, which I think we already know, but
it's interesting. When I was at Align years ago, the data that came back from the concierge program was that if you were to get a patient, so a patient calls for a consult, and this might be more geared to a practice like yours, Stephen, or an orthodontic practice, or even just for good process for a dental practice is that if you got a patient in for consult within 72 hours of them calling or requesting a consult, the acceptance rate skyrockets, right? Because they're ready, they're interested. If you, like in some practices, and I don't know where your practice is right now in terms of consults, but once you get busier, they start to go out further and further and further.
Totally.
But it almost needs to be a priority that new patient consults, we have to be able to get them in as soon as they want to, right?
Yeah.
Or as soon as possible.
And I
And
think
it
what
could
happens,
be like a pre-virtual thing. Like, so you have your top TC. Stephen has amazingly trained team members. Anyone could like just scoop up the top and give them that preview. There's no doctor time, there's no chair time, and you're also weeding them out because a lot of those people who call, they're wasting an hour of your time who come from different places. So if you can weed them out before they even see the doctor, that's fantastic.
Well, and that's the thing that is true is what happens is some of the systems that are actually the best as you grow, they change. And like you said, when we first started, we would be like, okay, yeah, let's get these patients in right away. And then all of a sudden you find out that you're like, oh, I have 80 consults booked this month and I'm booked out for a really long time. And now you're booked out 6 weeks and there's no spots and there's no availability. And then you kind of start weighing the pros and cons of you're like, okay, well, where am I at with my happiness level right now? Am I wanting to try and do more volume? If I am, I need to like get these patients in sooner because I'm bleeding patients by not being there. Then the flip side is saying, well, I'm pretty happy with where I'm currently at, and I'm going to leave this because this system is running efficiently in our practice right now. So you do reach a point where you start saying, do I want to become more profitable and see more patients and be busier? Or do I need to take a step back and I stabilize and I know that this is not the best practice? There's better ways of doing this, but for the stability of our practice, this is now how we're going to run it for a period of time. Mm-hmm. And that's actually where we, again, I'll always be completely honest and truthful in our, whenever I'm talking to doctors and you guys too, is that's where we kind of got to a point where it was like, I was running so many cases and was so freaking busy with the volume that I was running, even though I have now scaled back and I'm only doing I was doing like a few days a week before moving from Grand Prairie, and now I work 1 week out of the month. But I kind of got to the point where it was like when I'm working, I'm really, really, really slammed. And I don't necessarily want to take on that many more because I don't think I can physically handle that. And that's where we made the decision then to say, okay, I need to start bringing in other team members, another doctor who knows how to do, I'm going to teach to do aligner therapy and who's going to take some of this volume because it's all there and we don't want to be turning it away. So now we're starting to turn into the practice where we're like, okay, we have multiple doctors who can do this. And we're starting to build out kind of that larger infrastructure that I'm no longer such a cog in that wheel. But there was a point in time where we kind of said, okay, we don't necessarily even want any more consults because we're just so like we're at capacity for what we're happy to handle. And that's okay if as a doctor you get to that point you don't want to keep growing because you've kind of like you've reached the end game. Like that's you've won at that point if you get to that situation. But then I would encourage you to say, okay, well, why don't you just go ahead and get more doctors in the practice? So
awesome.
Yeah. Well,
we're all
I
like,
think
happy days.
We're all just like, oh man, I'm tired. That was a long podcast.
Yeah. We got through everything. We got through all the points.
We did. And so I want to talk one last thing on time, just for those who have managed to make it this point. The thing that you have to do too is that if we were looking at barriers to you growing as a doctor is your time. And I get this all the time that people say, okay, well, I want to learn. I want to get better. I want to be doing what you're doing. But then they're not willing to put in the work, to put in the time. And so if you're a doctor who's listening right now and you're like, man, that sounds great. I want to work a week a month and make all this money and like have this awesome lifestyle and either focus more on your family or focus on your hobbies and do whatever you're doing. Or you want to just go ahead and like increase your volume and work 4 weeks out of the month that busy. You need to take the time in order to step back and work on your systems, work on your efficiency, work on your office, work on your education. And so, again, I hear it. I want to do what you do, Stephen, but I can't find the time in order to sit down and actually like take the courses because they're comprehensive and there's a lot of information in there. And so what I've been encouraging and counseling doctors to do is to plan off 2 hours per week. during the week. Like do it not when you're at home, when you're not going to end up doing it. Plan it like on a Wednesday morning that from 8 a.m. till 10 a.m. all your other staff are working, but you're sitting down in your office and you're watching clearly aligned videos to learn about efficiencies and work on your business. Because if you don't plan that time and you're not dedicated enough, or life is just too busy that you can't get to learning from the content that's available online, well, you've bought this course and it's just sitting there and it's empty and you're not actually getting any better. So the problem is you're in this rat race where you're inefficient with your Invisalign treatment. So you're seeing patients for 10 hours per case. You should be seeing them for 4 hours per case.
Yeah.
But you haven't watched the 2-hour video that's going to explain to you how to change your systems to make it better. And so you've got to budget that time into your schedule to say, okay, I'm going to learn, I'm going to get better. Else you're always going to be stuck in that inefficient cycle.
Yeah. You have to invest in yourself first. You have to slow down to speed up and to grow, like for sure. We all invested our time. Ours was evenings and weekends, but now we're coasting. I mean, I'm still working evenings and weekends.
But yeah, it's just, you said it
The
perfectly.
joke is on me.
you have to slow down to speed up sometimes. And I think that's really important. So again, I've been talking about how we present the financials to patients, and we need to kind of, we need to not look at it as selling. And so the same thing with these courses here is that I want to just give an opportunity to talk about what we have available for doctors. We have extensive online courses that take you through from A to not quite Z yet, but take you extensively through all the different things that you need to know. If you're watching this and you're like, how do I grow and improve as a provider? We would like to think that we have one of the most comprehensive educational platforms in the world for you, both with online and in person. Feel free if you are like, yeah, I am very motivated. I want to take the next step to doing very comprehensive, all involved, engaged aligner therapy. Talk to Chris about Clearly Next Level. Clearly Next Level is a program established, a group of comprehensive education provided for doctors to increase the volume of Invisalign treatment that you're doing in your practice. We give different systems. Chris, so I'm starting to reach the end of my podcast time here. Can you give a description of it?
No, I would say, Clearly Next Level really, again, is an Invisalign specific growth network centered on comprehensive education. So as being part of the network, you're going to have complete support and education to really reach your goals of growing your Invisalign practice. And as part of the network, you also have some business advantages as well when it comes to Invisalign in the practice. So, if you're a doctor that's looking to grow and you really want to educate yourself and expand your scope of practice with Invisalign, then the network, Clearly Next Level, would probably be something that would be a fit. But obviously it's got to be a fit on both sides, right? We want to have a strong partnership with doctors. But if that sounds like you, definitely you can reach out to me. My email is chris@clearlyalign.ca, CHRIS, or give me a call, 587-337-8321.
Dangerous putting your phone number out online.
Damn. I'm a sales guy. I pass my card around everywhere. Everybody's got my number. That's not a problem either.
Fair
you can
enough.
call me. But yeah, if you do want more information about Clearly Next Level, right now we have about 100 doctors across North America that are part of our network, and we will be expanding the network quite quickly in the next few months and then through 2024. So would love to have a chat and see if it's something for you guys and gals.
Awesome.
No,
all right.
Fun. Oh
And-
my gosh,
and
we can
last-
chat our way through a whole day.
Yeah, last thing I just want to hit on is if you also need support with their ClinChecks, we
Yes.
have comprehensive ClinCheck services where we will help design the ClinChecks. We'll design the ClinChecks and provide education as to what we would do differently and give a video. And we'll even work with you through your entire case from initial prescription form all the way through the very, very end of treatment, providing every single ClinCheck. So that's all available on clearlyalign.ca.
Amazing.
Okay, well, thank you guys. This was
Kelly is the
great
lead
session.
on that part
Yes,
too.
yes, she is. And
No
does it-
case left behind.
No case
Talk
left
to
behind.
Kelly.
Yes, yes, absolutely. Okay,
Awesome.
great job, guys. Nice chatting,
All right.
and
So,
we'll see you on the
well,
next
thanks
one.
for having me.
Of
Yeah, our
course.
first guest.
Yeah,
Wow.
I like it.
Second time.
The last.
Yeah. Awesome.
All right, bye, guys.
Okay. All right. Have a great day, guys.
Have a great day.
Bye.